Hi guys, good evening. कैसे हैं आप लोग? Now, on behalf of Team Mist, I welcome you once again for these session of 25 most important clinical-based questions. For today, your subject is going to be pathology, and me myself, Dr. Kunal, will be host for this session. And what I'll be trying to do is to give you the insight of this particular subject, so as to make your whatever time you're going to spend with me fruitful. We do understand, and yeah, hi, good evening guys. A lot of you who are saying good evening, and good evening to all of you. And we know that we are already standing on 19th. It's practically the day is over, and you have little days ahead of your exam. Time is everything right now, so we are going to make this session as quick as possible and as informative and as beneficial as possible to you people. Now, what I have done in this session, I have included the 25, as the session indicates, 25 most important clinical questions. So we're going to be discussing that. And on top of it, I'm going to have some questions given to you without the options. And I would ask you people to answer that once you see those questions on your screens. So without wasting any further time, let's start with the session. And I hope and I believe that this session remains useful for you for your 4th of June FMGE exam. Okay, the first question goes like this. A 31-year-old male footballer suddenly lost consciousness while playing a football match. Scans were run and he is found to have enlargement of the left ventricle on echocardiography. What is the most appropriate mechanism related to his findings? So the options which you're seeing on your screens are atherosclerosis, B, hyperplasia, C, hypertrophy, and D, infarction. So I would like to ask you the answer for this question. Okay, so you people have started giving the options, the answers. Okay, so Vishal, Shoaib, Sushma. Okay. Wow. Yeah, so correct answer for this question is going to be C, hypertrophy. Now, what exactly they're asking? They're asking about, see, all the clinical history that's, we are having clinical questions, that's there. But then what they're asking here, they're asking just a simple thing, that left ventricular hypertrophy, the cardiac size when it is increasing, what is the reason behind it? And we know that everything in the heart, if the size of the heart is increasing, the mechanism is always hypertrophy, because your cardiac myocytes, they are non-dividing cells. So if anything is happening in the brain, anything is happening in your heart, or for that matter, your skeletal muscles, the only process by which the size increases, that's hypertrophy. Okay, hyperplasia can't be the answer here. Somebody has written B also. So B is not right. Hyperplasia cannot be the answer. Heart muscles, they are permanent cells. They cannot divide. Moving on to some rapid fire questions. What is the most common type of metaplasia we have? Alex, नहीं बेटा, डर सबको लग रहा है, डर हमको भी लग रहा है. The exam is going to come, but then we should not stop fighting. So most common type of metaplasia, please guys. Good evening. I hope you remember that what is metaplasia, when one type of adult cell or a mature cell is converting into another type. So Sharwan, Sushma, Sujit, Premchand, Vishal, very good. Wow. Amazing. No, beta, dekho. The type of metaplasia, if they're asking, the answer which you people are giving, that's right. The most common type of metaplasia which we have is our squamous metaplasia, no doubt about it. No doubt. But some of you have written Barrett's. Barrett's is a type of columnar metaplasia which we have. But the most common type of metaplasia which generally we have is a squamous metaplasia. Okay, beta? When the cells which are some other kind of adult cells and which are converting finally into a squamous cell, that's the more important, most common type of metaplasia which we have. Chalo. नेक्स्ट चीज की बात करते हैं. नेक्स्ट क्वेश्चन, caseous necrosis is seen with. Caseous necrosis, yes Yuvika, it's in smokers. This squamous metaplasia which you see, that is in smokers. So what will be the answer for caseous necrosis is seen with? Yes, Sparkle, very good. That's there. Yeah, TB, yes, very good, beta. This is your TB. Caseous necrosis is seen with TB, and the kind of appearance which we have is our cheesy-like appearance. Okay, cheesy-like. Another second, the third thing, most characteristic feature of irreversible injury, guys. Yes. Wow. You're not just telling me the most common cause for caseous necrosis, even the other examples you are giving, and I'm very happy about it. That's called as preparation. I'm very happy. So most characteristic feature, beta. Most characteristic feature of irreversible injury, any kind of irreversible injury, any kind of cell death, the most characteristic feature is going to be, yeah, Manoj, you are absolutely right. Sushma, Divyani, Dipendra, Naveen, Pushpendra, Nisha, every one of you. Amazing, guys, amazing. Very good, beta. It is your amorphous, flocculent densities. Amorphous flocculent densities. Now always remember the organ where you will find these, that's going to be your mitochondria. So if they ask you that what is the organ where you find these, that's going to be your mitochondria. Now coming to these images, now let's talk about this particular image. If I tell you that this image I have taken from a esophageal biopsy. Now what is the epithelium in the esophagus? That's your squamous epithelium. And I am saying that in the esophagus, I am getting this kind of epithelium and these kind of cells. So what exactly is this arrow depicting? What are these cells in the esophagus? Is it the normal finding of the esophagus? What are these cells? Now, yeah, Mohan, very good, beta, very good. This is your goblet cells, okay? The hallmark feature of Barrett's esophagus. This is a typical image of Barrett's esophagus where you are seeing these empty cells. These are your goblet cells, which you never see in the esophagus. You always see this in the intestine, and now you are seeing it in the esophagus. So, ये क्या image है बेटा? ये image है Barrett's esophagus की. Okay? Now, what does this image tells you? ये क्या है? Very good, guys, very good. Yeah, Avinash, mucin producing goblet cells. Yes. Yeah. Yes, sparkle shine, squamous to columnar intestinal metaplasia. Very good, beta, very good. What does this image tells us? Very good, Ritvika Rajput. Wet gangrene, liquefactive necrosis. Very good. So this question has been asked in your exam once. This is the same image they gave. This is our wet gangrene. And if I ask you, one more question I want to ask here, that wet gangrene is which type of necrosis? Which type? Very good, Kevin. Kevin, very good. This is your liquefactive necrosis. Amazing. So this will be your liquefactive necrosis. Moving ahead to the second question. Now, a chronic smoker develops a thrombus in his left LAD. Thrombolysis was done and the injured area is reperfused. The patient, however, develops an arrhythmia and dies. Grossly injured myocardium reveals infarcted area in the inferior wall of myocardium. Iron responsible for this kind of injury is, the options on your screens are sodium, potassium, calcium, and magnesium. So, okay, so you people have started giving the options. Now, Fazan Bashir. Okay. So some of you are giving potassium, some of you are giving sodium. Beta dekho, when we are talking, what is happening here? If you see this question, if what has happened? The person has died. Basically, cell death has happened. The myocardium is dead. What is the ion which is responsible for any kind of irreversible injury? What is the ion which is responsible for any kind of irreversible injury? The most important ion, that's always going to be calcium. So the correct answer for this question, kudos to people who have given the option as calcium. This is the most important ion leading to any kind of irreversible injury in our body. Okay. Another questions, beta ye batao kya hai? Fatafat batao ye wali image. What is this particular image? Yes, guys, I cannot take the names because there are so many people who are answering, and it gives me immense pleasure that you people, are answering. And yeah, so what is this particular image? Let me zoom this image for you. This is electron microscopy. Whenever you see a black and white image in pathology we say is always blue and pink, but whenever we are getting a black and white image, that means we are talking about electron microscopy. So what is these images? Yeah. Yes. Okay, so we are talking about this particular image, and most of you have given the right answer. Actually, everyone is giving the right answer. One or two, different answers I'm getting. I'll get back to this. You are absolutely right, guys. These are your myelin figures. If I talk about this, which organelle is this? Again, it's a black and white image. So again, this is an electron microscopy. You are seeing an organ, a very important organ, and that organ is your mitochondria, and you are getting something deposited inside the mitochondria in this black color. So what exactly is this? This is this image, beta. ये वाला image क्या है? You can't, I mean, you can understand with the smile on my face that, just by looking at the images, pathology images are difficult. People say that, but just looking at the images, you're able to answer that. So it's a big thing you have achieved. That means you people have worked really hard. So what are these images? Very good, Akash, Sushma. Amazing, guys, amazing. Yes, you're absolutely right. So देखो बेटा दोनों में फर्क देख लो. This is myelin figure. When you have these, round concentric deposits. ये breakdown of plasma membrane से आता है. This is your mitochondria, which is giving you amorphous density deposition. This is calcium which is getting deposited inside the mitochondria. Okay. अब ये वाला image कौन सा है? बताओ. What is this? This is again a very important image for your exam, and examiners, somehow they have a knack of asking this question in different ways. So if I tell you that this is a cardiac muscle biopsy, and I'm seeing cardiac myocytes, and here I am getting some deposits, you can see the deposits around the nucleus. So what is this? Yes, very good. This is your lipofuscin pigment, which is also called as lipochrome, aging pigment, wear and tear pigment, and it is a very important pigment which is there for a brown atrophy of the heart. So any old person given in the option and said that the person died, and we are getting a perinuclear pigment. क्या मिल रहा है बेटा अपने को? Perinuclear. The word perinuclear is very important, okay? So perinuclear pigment if we are getting, then it is this pigment which you have given the right answer. This is lipofuscin. Amazing. अब ये बताओ बेटा, ये ठीक है, this technique is DNA agar gel electrophoresis, which we are doing for, making a difference between apoptosis, necrosis, and all that. So we'll go one by one. I want you to tell me what is A. A क्या है बेटा? ये बताओ पहले. What is A? नहीं वो ठीक है बेटा. Okay. Yeah, Kishore. Absolutely. Okay. So you are giving mixed answers, but then you are giving me the right answers. So beta, this is absolutely normal. When you are not seeing anything, black means you are not seeing anything. There is nothing. So this is your normal. Okay. What is this B? As you people are writing already. Yeah, Nisha, very good. A normal, B step ladder. So this B is called as step ladder pattern, beta. ये क्या है? Step ladder. Or step ladder pattern is seen in apoptosis. So this is your apoptosis. And finally on this, as you have already answered, that this is gonna be necrosis. So ये क्या है बेटा? ये है necrosis. And what do you see? in necrosis, what this is called as? This is your smearing. ठीक है बेटा जी? So remember this, that if they might give you this image, they might give just the electrophoresis pattern and they ask you what exactly is this. So beta देखो, necrosis में the whole nucleus is gone. What is the most characteristic feature of necrosis? Karyolysis. So whole nucleus is gone, so whole the DNA fragments will get deposited like this. So it is called as smearing. When it is apoptosis, then you see these ladder patterns because the nuclear finding of apoptosis is pycnosis. पिचक जाता है न्यूक्लियस, छोटा हो जाता है न्यूक्लियस. सो दिस इज स्टेप लैडर पैटर्न फॉर एपोप्टोसिस, और नॉर्मल में तो अपने को कुछ भी नहीं दिखेगा. सो थम्स अप टू यू ऑल ऑफ यू. दीज आर पैथो इमेजेस. वी आर वेरी वरीड, पता नहीं आएगी, कर पाएंगे कि नहीं, बट अभी तक आई हैव शोन यू 4 images and you have given me all the 4 right answers. चलिए, क्वेश्चन नंबर 3. A 44-year-old female presents with swelling in the neck. Histological sections from this thyroid swelling reveals a papillary tumor with multiple scattered, small, round, laminated calcifications. All are true regarding the process except. So, first thing, whenever you are reading these questions, the thing is you should be clear in your mind that what exactly is being asked. Whether you are talking about a true statement from this or a false statement. तो बेटा देखो इसमें क्या लिखा है? If you see this, all are true regarding the process except. बहुत ध्यान देना इन क्वेश्चंस के ऊपर एग्जाम में. You have to be very, very, very attentive when you are reading these kind of questions. So they are asking you to have a false statement. ठीक है? अब देखो, depositions are present. Okay. बेटा ये नन की जगह ना इसको ऑल करेंगे अपन. ठीक है? नन की जगह विल डू ऑल. नाउ लेट्स सी दिस क्वेश्चन एंड लेट्स ट्राई टू फाइंड आउट. या, यस, देखो बेटा इसको ना ध्यान से करना है. पहली बात, इफ वी आर टॉकिंग अबाउट दिस क्वेश्चन, क्या हुआ? व्हाट आर यू गेटिंग? यू आर गेटिंग अ ट्यूमर. सो इफ यू आर गेटिंग अ पैपिलरी ट्यूमर, ये क्या है? व्हाट एग्जैक्टली इज दिस? Multiple, scattered, small, round, laminated calcification. What exactly are they? They are that particular structure which are very popular among the students when they give for the exam. Those are your psammoma bodies. So the examiner is telling you that in the tumor, the examiner is getting a psammoma body. So you are getting a psammoma body. अब ये पूछ रहे हैं that in this, when you are getting a psammoma body, which type of calcification is there for psammoma body? This is your dystrophic calcification, right? So we have two kinds of calcification. One is dystrophic, second is metastatic. So dystrophic calcification है. अब मेरे को बताओ बेटा, dystrophic calcification में what is the serum calcium level? Is it increased? No. So this can't be true. So this is a false statement. False statement है ये. ठीक है, we'll write F here. So this is a false statement. Now, next देखते हैं बेटा. Findings are specific to thyroid tumor. So the psammoma bodies, they are only found in the thyroid tumors. Is it the case? No. Psammoma bodies, what is the mnemonic we have discussed for psammoma body बेटा? क्या mnemonic किया है अपन ने discuss? And you all must be knowing that mnemonic. That is your PSM. Very important है ना? Mnemonic भी important है and the subject is also very important for the 4th of June exam. So PSM is the mnemonic. Papillary tumors में बेटा serous tumors and brain tumor. Which brain tumor? Meningioma. So this finding of psammoma body is not only and only specific to thyroid swelling. It can happen in other tumors as well. Deposition are due to decreased serum calcium levels. नहीं भाई. There are no decreased serum calcium level. In dystrophic calcification, the serum calcium levels are normal. Normal serum calcium levels. So, all the three statements are false actually. So, the answer to this question is, you want to find the false statement, the answer to this question would be D. सारे के सारे options false हैं. Nothing is right in this. Okay? चलिए, Now let's talk about this sensor, pro-apoptotic genes and anti-apoptotic genes. Now let's talk about the anti-apoptotic genes. देखो बेटा, इसको ना याद करना बहुत simple है. That anti-apoptosis means when the life of the cell. What is apoptosis? Apoptosis is cell death. So when the life of the cell increases, that means cell is living long life. So any molecule in which you have lastly L, that is your anti-apoptotic gene. तो बेटा देखो, first gene is BCL. इसके last में L है, तो BCL. अब नंबर कुछ भी हो सकता है, BCL2, BCL6, कुछ भी. ठीक है, whenever this molecule is working, the cell will have long life. The cell will not undergo apoptosis. That is why, if you try to think, you all have studied, all the tumors and everything, you must be remembering that follicular lymphoma has BCL2 positivity. Diffuse large B-cell lymphoma has got BCL6 positivity. So, beta, those are cancers. The cells, they keep on dividing. They don't die. Why? Because this is the molecule which is working over there. Okay? Very good, beta. Very good. Very good. Very good. Then your MCL. Then BCL-XL. So anywhere if you see, beta, you are having L at the end. So if you are having L at the end, that's your anti-apoptotic molecules. And then lastly, this BCL-XS. Up in the end, do not get confused and do not mark this as anti-apoptotic. This is not anti-apoptotic, beta. Why? Because if you see in this, the last molecule is S. The letter is not L. We are talking about the last letter, not in the BCL, but in the whole word. So in the whole word, what is the last letter? S. This means short life. Kam time ke liye jiyega ye. So this molecule is not anti-apoptotic. Instead, this molecule will cause apoptosis, so it is pro-apoptotic molecule. ठीक है? Pro-apoptosis का मतलब क्या हो गया? What do you mean by pro-apoptosis? Pro-apoptosis means that apoptosis will happen. So beta देखो, anything which contain A in the center, that's your pro-apoptotic molecule. Anything which contains A. A for apoptosis, बीच में अगर A है तो. Only one molecule, which is a bad molecule because it does not follow the norm, it contains A in the center. ये देखो, ये वाला molecule. इसके पास A है center में. So ideally it should be pro-apoptotic, but it never functions as pro-apoptotic. It functions as sensor. And अब जो भी आएगा एग्जाम में इसके अलावा सारे सेंसर्स हैं, like Puma, Noxa, BIM, Ambid. So all these are your sensors. Then these are your pro-apoptotic genes and these are your anti-apoptotic genes. Simple है बेटा. Anything contain L at the end, that's your anti-apoptotic. BCL-XS is pro. Bad is not an anti-apoptotic gene. It's a sensor. और उसके बाद जो भी है वो सारा sensor है. ठीक है? So, yeah. Yes. Manoj, you are right. Very good. चलिए. Fourth question. In cellular events of acute inflammation, all are seen except. So what is not seen in acute inflammation in the cellular events? Let's see. Complement involved in complement system is involved in chemotaxis. ICAM is used for adhesion of leukocytes. PCAM is for activation of leukocytes and selectin used for rolling. So which is correctly matched, which is not, and what is out of these options, what is not matched correctly? That is what we have to find out. So I'm waiting for the answers, guys. Okay, somebody had said A, then B, then Ritvika, you are saying A, C, Pushpendra C, Alok. Okay, so there are A options are there, C. Okay. So there are mixed options. Let's see that. But a complement is used in chemotaxis. एक बात बताओ, for the chemotaxis, what is the most important molecule for chemotaxis? For attraction, what is the molecule which is most important? किससे बुलाते हो आप WBCs को? फटाफट बताओ मेरे को. Tell me by what you are calling the WBCs. Most important molecule. Ashi, no. Yeah, Fazan Bashir, very good. Very good. Yeah, Pushpendra, you are right. Prerna, you are right. Dekho beta. Yes, yes, very good, very good. Now you are starting giving me the right answers. Beta, chemotaxis ke liye the most important molecule is C5A. And from where you are getting the C5A? From the complement itself. So this is right. You see this. Now ICAM. ICAM is a ligand for integrin. And what are the integrins used for? Adhesion. So this also is right. Now PCAM molecule. This platelet endothelial cell adhesion molecule, ये किसके लिए use होता है? You people have given me the right answer. This PCAM beta, PCAM is used for diapedesis. PCAM is used for diapedesis, not for the activation. No. So this is not seen. And selectins, yeah, they are for rolling. Selectins, they are for rolling. So the correct answer for this question, you people have given me the correct answers. C. The confusion was with the A because I have not written that C5A is for chemotaxis. I just wrote complements are involved in chemotaxis. So, it took a little while for you to understand. But these kind of, option change. So, जब आप question solve कर रहे हो, when you are trying to read the question, it is mandatory that you are reading and you are trying to analyze what they are saying. ठीक है बेटा? So, the correct answer for this question is C. आगे चलते हैं. अब rapid fire करते हैं फटाफट. What is the hallmark of acute inflammation? What is hallmark of acute inflammation? Happiness zone. Yes. PCAM याद रखो. PK लड़खड़ाया. Okay. Diapedesis. Okay बेटा. ठीक है. चलिए. Hallmark of acute inflammation. Waiting for your answers. Dhaval. Beta, it is not the hallmark. It is not the hallmark. Fazal, you are right. Gosu Ansari. Yeah, absolutely, absolutely. Wow. It is increased in vascular permeability. Hallmark पूछा बेटा. What has been asked? It has been asked hallmark of acute inflammation. That's going to be increased vascular permeability. अगला चलते बेटा. Cells of acute inflammation. What are the cells of acute inflammation? फटाफट बताइए. Acute inflammation की बात हो रही है बेटा, है ना? We are talking about. Yes. So we are talking about acute inflammation here. And नहीं बेटा, साई, no. Beta, in acute inflammation, we are not. No, beta. Yeah. Jeff, you are right. Ritvika, Arnab, Manoj, Faizan, Onkar. Thumbs up. So the cells of acute inflammation, beta, that's going to be your neutrophils. Okay. So they might give you a clinical question. Now it will become a clinical question in a way that they might give you that a person has an acute inflammation, and because of that acute inflammation, let's say they just, I think last time a question came, the patient is suffering from acute appendicitis. He has been operated, the appendix has been removed, and it has been taken to the pathology lab for biopsy. What kind of cells you're going to get inside? So beta, क्या मिलेगा? Acute appendicitis है, so neutrophil मिलेंगे because neutrophils are the cells of acute inflammation. ठीक? चलिए ये बताइए बेटा, LAD1 is due to deficiency of. What is LAD? LAD is leukocyte adhesion defect. तो बेटा किसकी deficiency की वजह से होता है LAD1? Your options would be in the exam would be selectin or integrin. तो क्या choose करना है बेटा? What we have to choose out of these? Yes, you people have given. Yeah, Fazil, very good. Naloxone, Manika, amazing. Wow. The correct answer for LAD1 is going to be integrin. This is for LAD1. And if we are talking about selectin deficiency, then it is LAD2. Selectin deficiency की वजह से LAD2 होती है बेटा. I'm really very happy, and I just can't tell you that, how happy it feels when you people answer all these kind of questions. Just keep this momentum going on into your preparation, and I'm telling you, on 4th, you're going to come with a happy smile like mine right now. Chaliye, most potent free radical. Yeah. Yes, happiness zone, because you know the CLL Lewis X is a ligand for selectin, so that can also be in the ops. Beta, it is OH minus, most potent, and most potent antioxidant vitamin. Yes, vitamin की अगर अपन बात करें, yes, 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 it's your vitamin E. ठीक है, vitamin E, most potent antioxidant vitamin. Okay. Coming back to the next question. Most important cytokine involved in granulomatous inflammation. So they are talking about the granulomatous inflammation. What is the most important cytokine? Yeah, yeah. Yes, absolutely. Absolutely. A big clap for you people. A big clap from my side. Okay, most important cytokine involved in granulomatous inflammation, interleukin 4. Second option is TNF alpha. Third option is interleukin 6. And the fourth option is going to be, okay, you have started giving me the answers as well. Wow. Wow. Pushpendra, Umanrati, Hritika, Prerna. Yeah, absolutely. You are giving me the right answers, and I'm very happy that whenever we are talking about a granulomatous inflammation, guys, it is granuloma formation. Granuloma is, when we are finding the granuloma, we are finding the granuloma in a chronic inflammation. What are the most dominant cells of chronic inflammation? The macrophages. In a granuloma, you have activated macrophages. So basically, the examiner wants to ask you, what is the cytokine for macrophage activation? So the macrophage activation cytokine, as you have given me the right answer, and I'm really very happy about it, that's going to be your interferon gamma. Okay? चलिए आगे चलते हैं. Then, let's do this also. Let's see that, how many of you remember these important cytokines, because they might not be asked, but then, yeah, they might be asked in a way that they can give you in a question and they can ask you what will happen because of them. So, interleukin 1 की वजह से क्या होता है बेटा? What happens due to interleukin 1? Tell me. क्या पुष्पेंद्र? I've seen your answer बेटा. अगले उस पे आते हैं, next पे आते हैं. Actually, the stream is 10 seconds delayed at your end. तो वो थोड़ा सा, yeah. Very good Bittu, very good Sujit, Hema, yeah. So it is for fever. चलो अगला next. 4 and 6 बताओ बेटा. 4 and 6. Interleukin 4 and 6. ठीक है, these are important interleukins 4 and 6. इनका ना ये चौका और छक्का है ये. So this is चौका and छक्का. So these 4 and 6. Yeah, Mamun. Bin Pendi के लोटा है ये. So this is pro and anti-inflammatory both बेटा. दोनों होंगे इसमें. ठीक है. Interleukin 5. Very good Prerna. Very good. This is eosinophil. चलिए, साई एकदम करेक्ट है बेटा. eosinophil है. अगला बताओ, इंटरल्यूकिन 8 बताओ. 8, इंटरल्यूकिन 8. Interleukin 8, yeah, Mamun, you are right. I think some of you are a little behind. You can, yes, you are right. Oh my God, Pushpendra, amazing man, amazing. Neutrophil, you are right. So whenever you need neutrophil influx, the body secretes interleukin 8, and wherever interleukin 8 would be, neutrophil will reach there. 10-13, yeah, absolutely, Kevin. 10-13 would be for anti-inflammatory, for repair. Yeah, Manoj, you are right. It is for repair. When we talk about TGF beta, this is again for fibrosis. Whenever the body is repairing and it has to do a maximum repair, a massive repair somewhere, so TGF beta is secreted. Like in the process of cirrhosis, when a massive repair is going on inside the liver, TGF beta is secreted. VEGF, yeah, you are right. You are right, guys. Right. So VEGF, when we are talking about VEGF, what exactly? So VEGF, we are talking about angiogenesis, neovascularization. Yeah, Sushma, you can write it neovascularization or angiogenesis. Interferon gamma, you have just told me for macrophage activation. C5a, अभी अपन ने बात करी है बेटा, अब भी बात करी है C5a की. What is C5a used for? See, in the complement system, there are multiple mediators which will be there like C5a, C3a, C4a. All these will do the same thing. But the most important, if they ask you, it is going to be C5a. And C5a के लिए आंसर बताओ बेटा फटाफट. Yes, Alia Khan, you are right. Sushma, you are right. Yeah, Fazan, Sujit, Aishwarya, you all are right, beta. This is for chemotaxis. And last, this also you have given me the options, opsonization. So you see, you know all this. Be proud of yourself. C3b is for opsonization, C5a is for chemotaxis. ठीक है बेटा? चलिए आगे चलते हैं. देखते हैं ये कितने लोग सही करते हैं क्वेश्चन. Comment on the cells seen in the image given below. बताओ फटाफट. Comment on the cells seen in the image given below. Is it an epithelioid cells, Langerhans giant cell, Langerhans giant cells, or Teuton giant cell? Okay, so I'll just zoom the image for you, and I am basically talking about this particular cell here, or you can take this particular cell. These cells I'm talking about. So what are these cells? देखो बच्चे, ये ध्यान रखना, इसीलिए I have put both these options, okay? Langerhans कुछ नहीं बेटा, Langerhans है, ठीक है? Langerhans giant cell होता है. So they have given both the options, but then the correct answer is B here. Langerhans giant cell. Langerhans is for your antigen presenting cell, बाद में देखेंगे उसको, but Langerhans giant cell, the correct answer is B. So all of you who are giving B as the correct answer, चलिए. चलिए. Now let's talk about this. What exactly is this? हाँ जी, ये क्या दिख रहा है आपको? ये क्या है? Yes. Yes, very good guys. This is nothing but keloid. अच्छा एक बात बताओ, फटाफट से बताना, what is the most common site for keloid? Most common site for keloid. You are right, you people are right. Amazing. बेटा keloid है पक्का पक्का. वाह यार. Yes, Sujit. Yes, Sujit. The most common site is gonna be sternum. Sternum नहीं दिया होता बेटा. In your exam, they have given you a question in which they have given an image और यहाँ sternum पे keloid दिया हुआ था. ठीक है? ये क्या है? What exactly is this? What exactly is this? This is an image of. Yes, you are right. This is an image of granuloma. So they will never give you the image directly like this, but if at all they give you, then granuloma, as we know, is made up of four things. One is going to be this center में there would be necrosis. Necrosis कैसा दिखता है बेटा? Necrosis में ना cells properly नहीं दिखते. Whenever you are seeing necrosis, it looks like, slump, कीचड़ जैसा दिखता है. So there is nothing here. If I zoom this, कोई proper architecture नहीं है. There are cells inside. What are these cells? If you see this particular cell, this is a epithelioid, slipper shaped nuclei. So all these slipper shaped nuclei, these are your activated macrophages. और जितना भी ये डॉट्स दिख रहा है ना बेटा छोटा छोटा, these are your lymphocytes and it is surrounded by giant cell. तो देखो बेटा ये साइड में ना यहाँ पे ये giant cell है. So whenever we are talking about a granuloma, this is a granuloma image. So there are four things. One is central में necrotic core होगी, epithelial cells, your lymphocytes, and lastly your giant cells. So these are the four things which are making a granuloma. This is an image of granuloma. ठीक है, ये क्या है बेटा, ये वाले कौन से cells हैं? If I say this is a type of a giant cell, which type of giant cell this is? बेटा this, if I am saying it's a giant cell, तो giant cell में क्या होगा बेटा, ये center में nucleus आ रहा है ना, this is your Teuton giant cell, Teuton. और ये वाला giant cell, again periphery में आ रहा है, this is the nucleus are in the periphery, so Langhans, yes Ritvika, it is Langhans. And finally ये वाला giant cell कौन सा है, what is this giant cell? इसमें, if I am saying it's a giant cell, then what kind of giant cell it is? Because we have haphazard arrangement of nucleus, so we are having what? We are having this will be called as foreign body giant cell. ठीक है, चलो आगे चलते हैं, बताइए. Seventh, yes, foreign body, yeah, absolutely. So let's talk about this question. A 55-year-old male, chronic alcoholic, underwent liver transplant 3.5 months ago. He came to the surgeon again with complaints of indigestion, upper right quadrant pain, nausea and vomiting. Scans were run and finding came out to be consistent with transplant failure. The true statement about this transplant rejection is, so you want to find out the true statement. This is a transplant rejection. So how many kinds of graft rejection we have? 3 kinds of graft rejection, the hyperacute, acute and chronic. Now let's take about this. Tell me the answer out of this. Is it a chronic graft rejection? Second option is HLA matching is not required for this transplant. Probable cause is antibody mediated injury to the liver of this transplant failure, and rejection of this transplant is due to high allergic stimulus due to graft. Yes, beta dekho, whenever we are talking, the first thing we have to find out in this is what kind of graft rejection it is. So as I said, there are 3 kinds of graft rejection: hyperacute, acute and chronic. So hyperacute graft rejection, as we have discussed already, within minutes to hours it will happen. जैसे ही आप graft लगाओगे reject हो जाएगा. Acute graft rejection is from days to months, but how much? Less than 6 months. And chronic graft rejection is more than 6 months. More than 6 months. तो यहाँ पे कितना दिया है बेटा? 3.5. So that means this falls under the category of acute graft rejection. ठीक है बेटा? Acute है ये. अब अपने को देखना है that why this happens. So hyperacute graft rejection, we know that hyperacute graft rejection occurs due to type 2 hypersensitivity. Chronic is due to type 4 hypersensitivity, and acute is more type 2 than type 4. ठीक है, तो अब देखते हैं बेटा, ये chronic है क्या? आपको कौन सा, what you have to find out? You have to, yes, yeah. So you have to find out, देखो बेटा, आपको क्या निकालना है? True statement निकालना है. You have to find out the true statement. So it's not a chronic, this is, can't be the answer. HLA matching is not required for this transplant. Beta, HLA matching we are not doing for any kind of transplant where, you do not have role of blood mixing, like for the cornea transplant. यहाँ पे 6x6 matching might not be required, but still you need to match. So ये, out of the options given, we have to see. Now, probable cause is antibody mediated injury to the liver. What is antibody mediated injury to the liver? Which hypersensitivity it becomes? The hypersensitivity becomes type 2. So we are talking about acute graft rejection, and we know that acute graft rejection is due to type 2 hypersensitivity. So obviously this is the best answer which we have in this question. Allergic stimulus to the graft, that means allergic hypersensitivity is what? Type 1. So any kind of graft rejection can be type 1 hypersensitivity? नहीं. So ये भी नहीं हो सकता बेटा, ये भी नहीं हो सकता. The correct answer for this question would be C. Yeah. Yes. So the correct answer is C beta. C है इसका correct answer. Best answer out of these given options is going to be C. Yes, we will upload the PDF. बेटा PDF मिल जाएगी आपको. चलिए बताइए best APC. What is APC? Antigen presenting cells. Yeah, Medico C would be better than B in this question. So now I'm talking about the best antigen presenting cell which we have inside our body. Best antigen presenting cell. Very good, Gaura. Amazing. Yeah, dendritic cells beta. They are the best antigen presenting cells which we have. चलिए, marker for NK cell. Come on. जल्दी जल्दी करेंगे बेटा. Marker for NK cell. Yeah. क्या बताया था? NK cells का काम क्या होता है बेटा? धूम धूम मारना होता है इनका काम. Natural killer. They are called as killer cells only. So what is the marker for NK cell? Yes, very good Medico. Very good Prashant. Very good Hema. Amazing guys, amazing. It is 16 and 56. आगे बढ़ते हैं. NK cells kill. NK, yeah. वैभव अब तक 56. Absolutely. Encounter specialist है ये cell. NK cells kill what beta? Yeah, this is INI-CT question. Recently they have asked this question. अभी जो हुआ है थोड़े दिन पहले. NK cells they kill what? Yeah, they will be killing any cell which is viral, infected with virus. You have given me the answer. And anything which is, any cell which is tumor kind of cells, and NK cells will not kill anything containing MHC1. And all the nucleated cells of our body contains MHC1. That is why NK cells doesn't kill that. Now CD4 beta, CD4 binds to what? CD4 binds to what beta? CD4 which MHC? जल्दी से बताओ. Happiness zone, I know 16 and 56 were not given in the options, but the other options in INI-CT exam were for different cells. So you can also find out the options by ruling out. Okay? So there are other options also. Yes. CD4 will bind with MHC2 and CD8 will bind with MHC1. Yes, Kaushav, you are right. Yeah. Yes. So there is a rule of 8 which you people remember. CD into MHC equals to 8. तो अब देख लो आप अपने हिसाब से जो भी. You have given me the right answers. B to T cell ratio in the body. So how much inside our body is the B cell and how much inside our body are the T cell? The ratio for these cells. The ratio for these cells, guys. बेटा देखो, B cells का परसेंटेज कितना होता है? 10 to 20%. ठीक है, of total lymphocytes. And T cell कितने होते हैं? 60 to 70% of total lymphocytes. So the ratio will be around 1:3 to 1:4. The ratio will be 1:3 to 1:4. This will be the ratio of B to T cells. You are right beta. 1:3. Sachin, उल्टा होगा बेटा. उल्टा होगा क्योंकि 10 to 20% are B cells. You are giving me the right answers, and I'm really very happy that you are picking up, like you understood what I'm asking. So nice. Chaliye, 8th question. A 25-year-old male went for trekking. After consuming wild fruit while trekking, he suffered from swelling and redness on the face. What is the type of antibody responsible for this type of reaction? So बेटा suddenly हो गया, जैसे उसने कुछ खाया और उसको रैशेस हो गए ऑल ओवर द बॉडी. सो और फेस के ऊपर रेडनेस हो गया. एंटीबॉडी पूछा है बेटा. दे हैव आस्क्ड अबाउट द एंटीबॉडी रिस्पॉन्सिबल. IgA, M, G or E. So you have started giving me the options, the answers. Wow. This again, the correct answer is E. This is type 1 hypersensitivity. The antibody responsible for type 1 hypersensitivity is IgE. Chaliye, graft in the same person. Beta, this looks very simple, but I don't know, in your exam, somehow or the other, the examiner is fond about this. In alternate exams or in every third exam, they give you this question. So graft in, yeah, yeah, yes, you are right. Graft in the same person का बताओ बेटा फटाफट. ये तो बहुत अच्छे से आप लोगों ने, yes, histamine, mast cell and Th2. You are right. Same person, you are right. Auto. Next बताइए, next. जल्दी चलते हैं. Next बताइए, in the same species, very good. Allo, you are right. Now, identical twins का बताइए. So, in the identical twins, I'm waiting for the first answer. Yeah, somebody has given. So fast it is going, I can't read. I'm very sorry if I'm not able to take your names, but then I'm really very happy you can, guess from the smile on my face that I'm very happy by seeing the right answers. It is isograft and different species. As you have already given me the answer, it's a xenograft. Okay. Now, RH disease of newborn. What is the type of hypersensitivity? RH disease of newborn, what is the type of hypersensitivity? We have 4 type of hypersensitivity, 1, 2, 3, 4. So RH disease किसमें आती है बेटा? फटाफट से बताएंगे. RH disease, what kind of hypersensitivity do we have? Very good, Dhawal. Yeah, you are right. It is type 2 hypersensitivity. बेटा देखो exam में we don't know whether they're going to ask you these kind of questions, but then I feel it is important. They can give you a clinical based question and they can ask you anything related to blood and they are giving you an hypersensitivity because of it. So you have to go for type 2 hypersensitivity. Whether it's a ABO incompatibility, RH disease, कुछ भी हो, blood से related अगर कुछ है तो वो type 2 hypersensitivity है. Then Graves disease बेटा, Graves. Yeah, Prashant, the mnemonic is my blood group is RH positive. Shamraya baby 2. इतने सारे तो हैं नहीं, but yeah, it's 2. Graves disease, again it's 2. Then be positive, हाँ बेटा, सबका अच्छा होगा. Happiness, your name is also Khushi, so yeah. And T cell mediated hypersensitivity, T cell, last one. ये बताओ T cell. Yes, Amandeep, you are right. It is type 4 hypersensitivity. So अपने पास 4 हैं बेटा. A, B, I mean the type 1, type 2, type 3 and type 4. First is due to allergy. Second is for antibody. Third is for immune complex. And 4 is T cell mediated. So your mnemonics, which all of you might have learned, for type 2 it is my blood group is RH positive, and for type 3 we learn it as sharp. Let's talk about ninth question. A 79-year-old male passed away in the old age home. He was suffering from Alzheimer's disease. His last wish was to donate his body for research purposes to the hospital. After doing his brain biopsy, Congo red positive material is found deposited inside. What is the most likely composition of this material? Now, if you see the options, first, as soon as you read this particular stain, Congo red positive, it is a case of amyloidosis. And now they are giving you 4 different kinds of amyloid options: light chain, transthyretin, beta-2 protein, and beta-2 microglobulin. So what will be your answer? Beta, dekho. The correct answer, you are giving me the correct answer, yes. But there is problem with this C and D. Dekho beta, light chains. When we are talking about light chains, it is with multiple myeloma. Transthyretin, it is with cardiac amyloidosis. A beta type of amyloid is deposited with Alzheimer's disease. And beta, when we are talking about beta-2 microglobulin, it is generally associated with hemodialysis. So the correct answer for this question is C, beta-2, A beta. कर लेते हैं अपन, सब लिख के कर लेते हैं फटाफट. आप अलग अलग आंसर्स दे रहे हो. So let's see that. Most common type of amyloidosis. Most common type. This is your, yes, primary. Most common cause of death in amyloidosis. What is the organ which is gonna cause amyloidosis? Most common cause of death बेटा, death की बात हो रही है यहाँ पे, death. Most common cause of death in amyloidosis. Which organ is involved? बेटा डेथ के लिए बात कर रहे हैं अपन यहाँ पे ना, वी आर नॉट टॉकिंग, या पुष्पक यू आर राइट, यू आर राइट बेटा, डेथ के लिए इट इज योर हार्ट फेलियर, ठीक है, हार्ट के अंदर तीर लग गया, हार्ट फेलियर इज फॉर द डेथ, एंड इफ समबडी आस्क यू मोस्ट कॉमन ऑर्गन इन्वॉल्व्ड, then you are giving me the right answers now, it is going to be your kidney. So the organ which is more commonly involved in amyloidosis is kidney, but then the most common cause of death in amyloidosis would be your heart failure. Amyloid associated with medullary carcinoma thyroid. Medullary carcinoma thyroid बेटा amyloid कौन सा है? Yes, Yash, you are right. Wow. So बेटा yes, it is your ACAL. Calcitonin, amyloid calcitonin, gene for MHC, gene for MHC beta. Alia, you are right. Yes. App in a zone, मृत्यु हो जाएगा. Yes. Gene for MHC is located on which chromosome beta? Chromosome का number बताओ फटाफट. Tell me number. Yeah. Medico, you are right. It is on chromosome number 6 and in the small arm, 6p. Amyloid associated with multiple myeloma. Multiple myeloma बताइए. Amyloid associated with multiple myeloma. This is gonna be amyloid. Which one? अभी अपन ने बात करी थोड़ी देर पहले. Multiple myeloma. And amyloid associated with hemodialysis. A मैंने लिख दिया है. आगे आप बताएंगे. Yes. Gaura, you are right. Rajesh, you are right. Amazing guy. Doctor. Oh, yeah. AL. And somebody has given me the answer for even for the hemodialysis. That is your A beta 2 microglobulin. ठीक है बेटा? Very. ये कर लेते हैं. Let's talk about this. Let's talk about this. Yeah, Gaura. Anaplasia is loss of differentiation. तो बताओ रेडियो सेंसिटिव फेज, मोस्ट रेडियो सेंसिटिव फेज कौन सा होगा? यस आलिया, हमारा पैसा, हमारा टिश्यू, हमारा पॉपकॉर्न. वेरी राइट. यस, द मोस्ट इंपॉर्टेंट फेज सेंसिटिव की अपन बात कर रहे हैं. यू आर राइट, इट इज G2M. और रेडियो रेजिस्टेंट फेज क्या है बेटा? व्हाट इज द मोस्ट रेडियो रेजिस्टेंट? यू आर राइट पुष्पेंद्र, अमेजिंग. दिस इज योर G1S. आगे चलते हैं. टिश्यू, मोस्ट रेडियो सेंसिटिव टिश्यू. लेट्स टॉक अबाउट द मोस्ट रेडियो सेंसिटिव टिश्यू. फटाफट बताओ बेटा, मोस्ट रेडियो सेंसिटिव टिश्यू क्या होगा इन द बॉडी? खुर्शीद, आई डोंट नो मैन, नेक्स्ट कब से होगा? अभी किसी को भी नहीं पता है नेक्स्ट कब से होगा. Yes, most radiosensitive tissue is bone marrow. Radio resistant, you are right Rahul, it is neuron. Blood cell which is most radiosensitive, you just learn this. The blood cell which is more radiosensitive, most radiosensitive, this is gonna be your lymphocyte. And yeah, and the blood cell which is very radio resistant, that's going to be your platelet. And lastly, the organ which is most radiosensitive comes the gonads. In the gonads, testes being more as compared to ovary. And radio resistant mein, in the radio resistant, come on. Yeah. In the radio resistant, the organ we are talking about here. Yes, very good. That's going to be vagina. Absolutely, guys. Absolutely. Thank you very much for answering this table completely with me, and I'm very happy with this. चलिए, match the following. Question number 11. Synaptophysin. देखो बेटा, ये match करना है अपने को. What is synaptophysin for? So let's talk about this. Synaptophysin. synaptophysin for which one? CA99 is for what? Cytokeratin is for what? And C-MYC is for what? Yes, you have given me already the correct answer for that. Absolutely. The correct answer is synaptophysin and chromogranin. They are for neuroendocrine tumors. So A we have to match with 3. Then CA19.9, that's going to be with your pancreatic or the colon cancer. तो कहाँ पे B किसके साथ मैच करेंगे? 4 के साथ. तो बेटा ये देखो A3, A3, B4. Very good. Yes, Shrijit, you are right. A3, B4. बेटा cytokeratin is for any kind of epithelial malignancy. Then C-MYC तो सबको पता है बेटा. सब बच्चों को पता होगा C-MYC is for Burkitt's lymphoma. So the correct answer is D. Now, hallmark of malignancy. If you are talking about hallmark of malignancy, what is the hallmark of malignancy? चलिए हॉलमार्क ऑफ मैलिग्नेंसी करते हैं. थोड़ा बहुत ऐसे मैचिंग भी करते रहने चाहिए ना. कभी आपके एग्जाम में क्वेश्चन आ गया तो क्या करेंगे? वेरी गुड बेटा. हॉलमार्क, इफ दे आर आस्किंग अबाउट हॉलमार्क, इट इज योर एनाप्लेजिया. And this is why I have asked this question, because some of you have given metastasis. Beta, metastasis, if we are talking about metastasis, this is the surest sign, beta. Surest sign of malignancy, it is not the hallmark. If they're talking about hallmark, it is going to be anaplasia. Location of RB gene. What is the location of RB gene? Location of RB gene. Which chromosome? Very good, Dipendra. It is your chromosome number 13. कौन सा आर्म है? Q और लोकेशन क्या है? 14. So most common paraneoplastic syndrome overall. Most common paraneoplastic syndrome overall. Pushpak, I'll see question number 10. अभी देखता हूँ मैं एक बार. Let's move ahead. I'll come back to question number 10. क्या हो गया वहाँ पे? बहुत सारे लोग question number 10 को लिख रहे हैं. We'll see that. Yeah. So most common paraneoplastic syndrome overall. नहीं. Yes. Somebody gave me the Shimran. मैं चल देखते बेटा देखते. Hypercalcemia. The most common paraneoplastic syndrome overall is hypercalcemia seen with squamous cell carcinoma lungs. Okay. चलो ये again it's a question which have come in your recent NEET PG exam. Last NEET PG exam में आया था. So let's talk about these 4 types of chromosomes on the basis of centromere. अब आप मुझे बताओ what is A? What is A? बेटा hypercalcemia. चलो what is A? Yes, you have given the answer. A में centromere एकदम center पे है बेटा. It is exactly at the center. So what will be the answer here? Yes, very good. This is your metacentric. Then the second would be very good, Shagufta. You have given all the answers. Yeah. So if it is away from if the centromere is little away from the center, it is submetacentric. Then it is towards the periphery होगा ना बेटा? तो क्या हो जाएगा? It will be your acrocentric. And when it is at the top, then it will be called as telocentric. Top पे centromere. So top पे telo. T for T. चलिए. 12th question. A 17-year-old boy complains of teasing in the school due to resonance with female voice. So a boy came with a complaint of teasing in the school because he has a female voice. He also has very sparse body hair and facial hairs. He is otherwise very tall. On further clinical examination, it is found out that he is having atrophy testes. Which one of the listed karyotype would be responsible for these features? तो बताओ बेटा फटाफट. Yeah, you are right. You are right. You are absolutely right. It is a case of Klinefelter syndrome. And the most common genotype for a Klinefelter syndrome is 47XXY. Klinefelter syndrome is the most common genetic cause for male hypogonadism. Whereas Turner's is quite the opposite. Turner is 45XO when a female doesn't have a second X. Okay, and Turner syndrome is the most common genetic reason for female hypogonadism. चलिए ये बताइए बेटा. Next बताइए. Now maternal disomy, Angelman syndrome. क्या ये सही है? Is this true or false? Is this true or false? Maternal disomy, Angelman syndrome. सही है गलत? False. Absolutely. Maternal disomy will lead to Prader-Willi, not the Angelman syndrome. The diseases, this is what? This is your genomic imprinting, and the disease in the genomic imprinting is based on deletion. So if it is maternal deletion, it will be Angelman. Mothers are angel. Paternal deletion, Prader-Willi. If it is maternal deletion, आप याद ऐसे रखिए, अगर मम्मी का डिलीट हो जाएगा तो पापा का डबल हो जाएगा, like that. So maternal deletion and paternal disomy, they will give you Angelman, and paternal deletion and maternal disomy will give you Prader-Willi. So this is a false statement. Fragile X syndrome. Fragile X syndrome, what is the gene mutation responsible? Gene mutation responsible for Fragile X syndrome? Jaldi se. Yes. You are right. The gene mutation responsible for Fragile X syndrome is your FMR gene. Familial mental retardation gene. Okay? Familial mental retardation gene. Beta, no. Beta, dekho. The repeat in Fragile X syndrome is CGG repeat. You are right. CGG repeats are seen, but the gene mutation is FMR, familial mental retardation gene. And that is why Fragile X syndrome becomes the second most common genetic cause for mental retardation. What is the most common genetic cause? Most common genetic cause, yes, you are right. It is going to be your Down syndrome. What is the most common trisomy overall? Yes, Rahul, you are right. You are right. This is the most common trisomy overall is trisomy 16. Overall trisomy is trisomy 16. You are right. And yeah. And the most sensitive and specific genetic analysis technique. कौन सा technique है बेटा? कौन सा क्या है इस technique का नाम? What is the technique? बेटा Patau is trisomy 13. ठीक है? Patau is trisomy 13. Yes, you are right. The technique is fish. Happiness, yes. Trisomy doesn't live. Prerna, you are right. It is fish technique. Patel, yes, you are right, beta. You are right. चलिए आगे चलते हैं. A patient came to the OPD with complaints of fatigue, weakness, and pallor. On peripheral blood examination, spherical RBCs are seen. What should be the next step in the evaluation of the patient? Now, they've given you this image, but it doesn't stand any relevance. Why? Because in the question they have mentioned that you are getting a spherical RBC. Now, as soon as you see a spherical RBC, what should come to your mind? What disease should come to your mind when you are talking about spherical RBC? There are two diseases. Either it should be hereditary spherocytosis, or a person can have immune hemolytic anemia getting a spherocyte. So if these two diseases are there, you as a doctor have to find out कि भाई इसको है क्या. So what will you do? Yes, you are right. I am so happy. Thank you very much for this correct answer. That's going to be your Coombs test. Beta, do not mark electrophoresis. Electrophoresis is the confirmatory test as far as hereditary spherocytosis is gone. Okay, but then next step, they have asked about the next test for evaluation. That's going to be your Coombs. I'm really very happy. Thank you very much. Chaliye. Now, most common protein deficient in hereditary spherocytosis. Most common protein deficient in hereditary spherocytosis. Come on, guys. Yes, you are right. The most common protein deficient is N-chirin. N-chirin. And what is the most common protein deficient in hereditary elliptocytosis? Elliptocytosis. Yes, Ritvika, you are right. For elliptocytosis, it is gonna be spectrin. So please, 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 you see in the options, you see in the exam that what they actually are they asking. If they're asking hereditary spherocytosis, that the most common protein is N-chirin, and if they're asking for hereditary elliptocytosis, it is going to be spectrin. Pancytopenia with hepatosplenomegaly. This question has come in different various ways in your exams, that they ask you, a patient is having pancytopenia but hepatosplenomegaly is seen. Then the correct answer is going to be yes. If they are saying hepatosplenomegaly is seen, what will be the correct answer? Very good, Patel Divyani. Very good, Shanti, Ishan. या बेटा देखो ऑप्शंस के हिसाब से एक डिजीज आप याद करके जाओ, पीएनएच, पैरोक्सिस्मल नॉक्टर्नल हीमोग्लोबिनूरिया, पैनसाइटोपिनिया विद हिपैटोस्प्लिनोमेगेली. अगर हिपैटोस्प्लिनोमेगेली नहीं है पैनसाइटोपिनिया में, मोस्ट कॉमन कॉज एप्लास्टिक एनीमिया में चला जाएगा. ज्यादातर वो ऑप्शन में होगा. व्हाट आर दीज सेल्स? व्हाट आर दीज सेल्स? What are these particular cells? Yes, in PNH we have 55 and 59 deficiency, the DAF and MIRL deficiency. You are right. Very good, doctor. बेटा थैलेसीमिया में भी दिख सकता है, बट ऑप्शंस के हिसाब से मैं बोल रहा हूँ, probably they give PNH as the option for pancytopenia with hepatosplenomegaly. Yes, they are. You are right. They are bite cells. You can see this particular cell. This is your bite cell. You have even given me the options, answers for that. This is seen in G6PD deficiency. अब ये बेटा ये कौन सा है? बताओ ये क्या है? What exactly is this? What exactly is this? Amazing, guys. I mean, these are a special type of cells, some kind of, appearance this is, and they are some kind of yeah, Hema, you are right. Wow. Yes. So Hema, you are right, and Happiness, you are right. Yes, Omkar, you are right. You are even giving me the disease in which you see this. Absolutely right. These are your golf ball inclusions, and they are seen with alpha thal. And which kind of hemoglobin? HbH disease. And here you have 3 gene deletions. How many alpha genes will be deleted? 3 genes are deleted. So amazing. Very good. What are these particular cells? I'm making an arrow here. What are these cells? Beta batao fatafat. कौन से cells हैं ये? This can be a direct spotter in the exam. ये वाला image देके. So what are these cells we are having? The cells. Very good, beta. Very, very, very good. Target cells. Amazing. So these are your target cells. ठीक है, ड्यू टू प्लाज्मा मेम्ब्रेन, द आरबीसी मेम्ब्रेन माल फंक्शन हो जाता है यहाँ पे, माल फॉर्मेशन की वजह से. यू सी दिस टारगेट सेल्स. चलिए, आ पेशेंट प्रेजेंटिंग टू द क्लिनिक कंप्लेनिंग ऑफ पैलर, फटीग, वीकनेस. CBC reports indicate hemoglobin to be 9 gram per deciliter. MCV is 66 femtoliters. So hemoglobin is also going down. Even the MCV is going down because the normal volume of the RBC is 80 to 100. We are getting 66. PBS finding shows microcytic hypochromic RBC. So they are already telling you, the examiner is telling you already that this is small RBCs you are seeing. What is the cause leading to these findings? So बेटा most probable cause अपने को ढूंढना है यहाँ पे. बेटा नहीं, Simran, no. Rest everyone is giving me the right answer. बेटा देखो, whenever we are talking about a microcytic hypochromic anemia in our country, the most common cause for microcytic hypochromic anemia is going to be your iron deficiency. So the correct answer for this question would be C, iron deficiency. ठीक है, iron deficiency anemia ये IDA है. Vitamin B12 deficiency में you will get big cells. अभी बात करेंगे अपन उसके बारे में. ठीक है, चलो. Most sensitive and specific marker for iron deficiency anemia. Most sensitive and specific marker for iron deficiency anemia guys. बताओ कौन सा होगा. और फिर आपको ना ये टेबल भी बनानी है मेरे साथ. मेरे को बताना है क्या डिजीजेस हैं ये. So what is the most sensitive and specific marker for iron deficiency anemia? बताइए. Yes, you will get pencil shaped cells. Very good, beta. Happiness, you are right. Ritika, Rahul, Mohan. Wow. So this is your ferritin. So whenever somebody is suffering from iron deficiency anemia, first thing to get deranged inside the body is going to be ferritin. And when you start the treatment for the patient, the first thing which will improve, that also will be the ferritin value. ठीक है, तो इसलिए ये most sensitive and most specific होता है. What is the test to differentiate between the IDA and thalassemia minor? IDA and thalassemia minor, what is the test? Yes, you are right. Wow. This is your Menzer index. Menzer index. Okay, what is this Menzer index? This is your, when you are taking the MCV upon the RBC count of the patient. Okay, so thalassemia minor may be the cells, the RBC becomes small, and in IDA, the RBC becomes small. So sometimes it becomes difficult for us to, differentiate between the IDA and the thalassemia minor just by on seeing the PBS. We have to do further more investigations. So what we do is, we do this test. We do this particular test. In the IDA, what is IDA? Iron deficiency, the bone marrow is not functioning. So when the bone marrow is not properly functioning, it's a nutritional deficiency anemia. So RBC count overall banta hi kam hai beta. So overall the RBC count is very low in IDA. So Menzer index will be more. And in thalassemia minor, the RBC count will not be that low as compared to iron deficiency anemia. So the value would be lesser than the IDA. ठीक है? Yes. More than 13, it's RDA. If the Menzer index value is more than 13 is IDA and less than 13 is thalassemia minor. चलो बेटा ये वाला करते हैं अपन फटाफट. बताओ diagnosis बताओ. This has been a question in INI-CT exam recently. Before that, it has been asked in NEET PG, and in your exam as well, this question has been asked. So let's see the answer for this particular question. The first one is that iron is low, ferritin is high, TIBC is low, and transferrin saturation is also low. So somebody who is having overall iron in the body is less, but the ferritin is high. Ferritin, yes, Shimran. Rahul, you are right. Shanti, you are right. Divyani, you are also right. Rahul, no beta, no Rahul. राहुल बेटा ये सिड्रोब्लास्टिक नहीं होगा. सिड्रोब्लास्टिक होता तो टोटल आयरन भी इंप्रूव करना चाहिए था. सो दिस इज अ पिक्चर ऑफ अनीमिया ऑफ क्रॉनिक डिजीज. सो यू पीपल आर राइट बेटा, अनीमिया ऑफ क्रॉनिक डिजीज. एंड हियर इफ यू सी आयरन भी लो है, ferritin, the stored iron is also low, TIBC is high, and transferrin saturation is low. As you have already given me the correct answer for this question, this is going to be IDA. Now, what you have to do for the exam, just learn these two values. Okay? Low ferritin, high TIBC is seen for iron deficiency anemia, and high ferritin, low TIBC is seen for anemia of chronic disease. And I'm telling you, I'm really very happy that you have marked it correctly, have given me the right answers. Thank you very much for this. Okay? चलिए आगे चलते हैं. The next question, comment on the diagnosis with the PBS finding given in the image. So let me zoom the image for you. This is the image we are getting, and they're asking you that with this image taken into consideration, what is your diagnosis? Is it Hodgkin's lymphoma, or is it megaloblastic lymphoma, or it is anemia, and I mean autoimmune hemolytic anemia, or sideroblastic anemia? So please. Yes, you are right, beta. You are absolutely right. Thank you for giving such quick answers for the questions. This is your megaloblastic anemia. Why we are saying this? What are we seeing on this image? We are seeing hypersegmented neutrophil. Hypersegmented, what are the normal segments of the neutrophil? The normal lobes in the neutrophil should be 3 to 5. Wherever you have 6 or more than 6 nuclear lobes in a neutrophil, you call it as a hypersegmented neutrophil, which is a very, very, very prominent finding in a patient of megaloblastic anemia. तो ये हो गया बेटा. देखो lobes देखो 1, 2, 3, 4, 5, 6. So hypersegmented neutrophil, megaloblastic anemia. ठीक है. आगे चलते हैं. Absorption site of vitamin B12. Where is the vitamin B12 getting absorbed? Vitamin B12 getting absorbed बेटा फटाफट बताओ. ठीक है. ये अभी ना रिसेंटली एग्जाम में क्वेश्चन आया हुआ है एंड आई टेल यू व्हाट द क्वेश्चन दे गेव यू. कैसे वो आपको नॉर्मल चीज़ों को, जिन चीज़ों को आप समझते हो, यू ऑलरेडी नो इट, बट देन दे गिव यू इन अ ट्विस्ट एंड देन दे ट्राई टू मेक यू अ लिटिल डिस्ट्रैक्टेड फ्रॉम द एक्चुअल रोड एंड देन टू आस्क द क्वेश्चन कि कैसे करना है. सो एब्जॉर्प्शन ऑफ, यस बेटा, it is not duodenum. It is not duodenum. Duodenum is for iron, bache. For absorption of iron, it is duodenum. When we are talking about vitamin B12, as you have given me the option, it is terminal ileum. Terminal ileum. You have given me the right answer. Now, the question which they gave, now when we talk about the vitamin B12 absorption, we know that vitamin B12 will only be absorbed in terminal ileum if vitamin B12 is with intrinsic factor, and this intrinsic factor is secreted by stomach. So they just gave the question in the exam that if some patient has undergone gastrectomy, what kind of vitamin deficiency this person would be having. So they gave a clinical scenario and they gave a situation of vitamin B12 deficiency. So ये ध्यान रखना बेटा कि vitamin B12 absorb तो terminal ileum में होती है, but it needs intrinsic factor which is secreted by the stomach, then only it will get absorbed. Otherwise pernicious anemia हो जाएगा. चलो. Yes, happiness, iron in the duodenum. Very good. चलो ये वाला करते हैं बेटा. Let's talk about, देखो megaloblastic anemia, we have megaloblastic anemia due to vitamin B12 and B9 deficiency. So we need to understand as doctors that when a patient comes to us and we are saying okay it's a megaloblastic anemia, तो अपने को ये समझना होता है that whether we have to start with vitamin B12 or B9, which deficiency is actually there. So what we do is we do these two tests, homocysteine levels and methylmalonyl coenzyme. अब देखो पहले वाले में क्या है बेटा, homocysteine levels are high and we know. Very good, very good. First row answer, यहाँ पे कौन सा आंसर दिया है? You have given the answer as folate. Very good. And happiness, the second row answer is B12 and you are absolutely right. देखो बेटा, homocysteine, homo मतलब same. So homocysteine levels, they rise in both the deficiencies. Whenever B12 and B9 will be deficient, homocysteine will rise. But methylmalonyl coenzyme A levels, they are high only when vitamin B12 is deficient. So when both of these things are high, it could be vitamin B12, B9, anything. But once methylmalonyl coenzyme A is normal, that means it is not vitamin B12 deficiency. तो ये B9 है, यहाँ पे कुछ भी हो सकता है बेटा. फिर आप फिग्लू टेस्ट करके देखोगे. ठीक है. ये कौन सा सेल है? Which cell is this? What is this particular cell? What is this cell? Come on. And in which anemia we are seeing this? We are talking about megaloblastic anemia. We see this in megaloblastic anemia. This is a very peculiar cell. Figure of 8 we have. Always not present with figure of 8. But अगर ये है तो ये तो बिल्कुल ही characteristic cell है. And yes, Dr. Gosu, Naveen. Yeah. Very good, bhai sahab. Very good. You have studied well. This is your Cabot ring. What is this? This is your Cabot ring. चलिए आगे चलते हैं बेटा. 16 number. An African male came to the clinic with fatigue, fever, cervical lymphadenopathy, lymph node biopsy shows RS cell under the background of inflammatory cells. What is this RS cell? Reed-Sternberg cell. What is the viral infection associated with this condition? So whenever we see this particular cell, RS cell, we are talking about here Reed-Sternberg हो गया ना बेटा. कौन सा डिजीज है ये? Hodgkin's lymphoma. So they are asking you that which viral infection is most probably affected with, associated with this kind of Yes, you are giving me the right answers. Thank you very much for quickly responding to this question. The answer is Epstein-Barr virus. The Epstein-Barr virus. Hodgkin's lymphoma is a B cell tumor. B cells are more commonly involved in Hodgkin's lymphoma. It's a B cell tumor. So with B cells, we know EBV association. Classical Hodgkin's lymphoma marker, beta. Fatafat batao. What is the classical Hodgkin's lymphoma marker we have? Which CDs? Yeah, EBV के लिए mononucleosis भी है. Urvashi, you are right. चलिए, what is the classical Hodgkin's lymphoma marker? Yes, FMG, you are right. It is your 15 and 30. ठीक है? So classical Hodgkin's lymphoma is 15 and 30. What is the most common type of Hodgkin's lymphoma in world? What is the most common type of Hodgkin's lymphoma in world? Yeah. Beta, do not get confused with this question as, Burkitt's. It is not Burkitt's. We are seeing RS cells here. Reed-Sternberg cells अगर हैं तो वो तो they are the most characteristic finding for Hodgkin's lymphoma, no? So when we are talking, अगर ये Burkitt's का question होता तो the option would have been CMV, माना. But then now we are talking about an RS cell, so the correct answer for this question would be always and always Epstein-Barr virus. Yes, you are right. You are right. It is nodular. नॉडुलर स्क्लेरोसिस और इंडिया में अगर पूछ लेंगे बेटा तो मोनोन्यूक्लियर mixed type of Hodgkin's lymphoma is most commonly present in our country, and the kind of RS cell with mixed type of Hodgkin's lymphoma is mononuclear. चलो ये बताओ most common non-Hodgkin's lymphoma बेटा, most common non-Hodgkin's lymphoma बेटा, मजा आ गया, wow. Yes, Fazan, you are right. Sujit, right. Mixed in India, Augustine, you are right. Beta, yes. Dilip, you are right. It is most common. NHL is DLBCL, diffuse large B-cell lymphoma. NHL, non-Hodgkin's lymphoma with BCL2 positivity. बेटा ये नीट क्वेश्चन है, नीट एग्जाम क्वेश्चन है. लास्ट टाइम नीट जो एग्जाम में आया था उसमें दे हैव आस्क्ड BCL2 पॉजिटिव. This is gonna be, yeah, Bhargavish Rajput, you are right. Most, yeah, Ishan, you are right, beta, follicular. So it is follicular lymphoma. Don't get me wrong, we can see BCL2 positivity even in DLBCL also, but then probably more commonly follicular lymphoma has BCL2 positivity. And non-Hodgkin's lymphoma with starry sky appearance, you people are already giving me the options for that. Thank you very much. This is, I think, one of the most loved question as far as Burkitt's is concerned. c-MYC gene for Burkitt lymphoma and starry sky appearance. It's a non-Hodgkin's lymphoma, very poor prognosis, very aggressive, seen with HIV. You are right. चलो बेटा ये बताओ फटाफट ये क्या है? What is image number A and what is image number B? Image number A and image number B. It is always, a lot of issues are there with this particular, thing, that owl eye. These both are owl eye things, okay? But then they both are different. If they're asking about an owl eye appearance cell, which you are seeing, in a person of, let's say, Hodgkin's lymphoma, that's gonna be your Reed-Sternberg cell. This is your Reed-Sternberg cell. This is an owl eye appearance cell. Whereas this owl eye, which you are seeing, beta, this is inclusion into a cell which is making it as an owl eye. So ये inclusion है बेटा, ये appearance है. So if they are talking about an owl eye appearance cell, it's an RS cell, and RS cell is seen in Hodgkin's lymphoma. So the virus infection which is seen in this case would be EBV. But if they are saying that owl eye inclusion in which kind of viral infection, then it's going to be CMV. Because this happens due to cytomegalovirus. The viral inclusions, they get into the cytoplasm and the nucleus and they become like this. तो अगर आप इन दोनों में difference देखते हो, You see the cytoplasm here in this cell. So you are seeing so many inclusions inside. Whereas if you see the RS cell mein inside the cytoplasm, you are not seeing any inclusion. Whereas in CMV, you are seeing the inclusion. Even inside the nucleus, you are seeing the inclusion. Inside the nucleus of an RS cell, you see nucleus and then nucleoli inside. So beta दोनों में फर्क है. Auli appearance cell, RS cell, Epstein-Barr virus infection is, associated with it. But if they're asking Auli inclusions, then it's going to be CMV. और बेटा देखो, a question which is a past year question of yours, that transplanted kidney में क्या मिलेगा? Transplanted kidney के अंदर देखो बेटा, any kind of renal transplant के लिए most common infection after renal transplant is going to be CMV infection. So if they are using the word renal transplant, then don't go with EBV or CMV. They are using the word renal transplant, that means they are talking about CMV, because the most common infection in a renal transplant patient, because the patient is immunocompromised, is CMV only. ठीक है? Pleomorphic RS cells किसके साथ मिलते हैं? Pleomorphic RS cell, if we are talking about, then obviously pleomorphic, as you people, renal transplant में most common infection CMV होगा. वो वहां पे Auli appearance लिखें या Auli inclusion लिखें, does not matter. Yes, very good beta. LPHL, lymphocytic poor Hodgkin's lymphoma, mononuclear, M for mixed cellularity Hodgkin's lymphoma. M for M इंडिया में सबसे ज्यादा इंडिया में होता है. Popcorn, again P for P, you can match. Yes, very good beta. Yeah. So very, yes. Thank you. So popcorn RS cell, this is gonna be your nodular lymphocytic predominant Hodgkin's lymphoma, NLPHL, the non-classical variety. And the lacunar RS cell, which we have already discussed, this is your nodular sclerosis Hodgkin's lymphoma. Chale, let's talk about this HB electrophoresis image. देखो बेटा, ये this might not come directly, but then they might ask you the hemoglobin concentration in different diseases. I mean, the hemoglobin present in different diseases. This is a plate for hemoglobin electrophoresis, and we have different patients. Like this is, this one for reference, I am telling you that this is your normal one. Patients are these four. So in normal situation, if you are talking about an adult, in a normal situation, we have three hemoglobins: hemoglobin A, hemoglobin F and hemoglobin A2. आप में, मुझ में, सब में यही है. Maximum we have, if we are normal individuals, we have hemoglobin A, वो दिख रहा है. सबसे कम hemoglobin F होता है हमारे अंदर. You see the thinnest line is hemoglobin F, and hemoglobin A2 is approximately 3.5 से कम, around उतना. तो आप, you can see the difference है ना. Maximum is hemoglobin A in us. So it's an adult, a normal adult. Whenever you are using a hemoglobin electrophoresis plate, whenever you are using a hemoglobin electrophoresis plate, this is the way in which the hemoglobins will be deposited. अब मुझे बताओ, what is patient number 1? Patient number 1 में आपको क्या ज़्यादा मिल रहा है? Is it a normal male? नहीं. What is happening to hemoglobin A? It is going less. Hemoglobin F is little increasing, but then your hemoglobin A2 is increasing more. So what is the type of disease in which A2 becomes more? Hemoglobin A2. Yeah, it is Hafsa. It is Hafsa. Yeah, very good beta. A2 becomes more in beta minor. So it is your beta minor. This patient is suffering from beta thalassemia minor. So hemoglobin A2 ज़्यादा है. What is patient number 2? In patient number 2, these are all adults, okay? These are all adults. Patient number 2, hemoglobin A is very less, but then hemoglobin F has increased. You see, in an adult, from the normal one, what is your normal one? This is your normal. Normally A ज़्यादा होता है बेटा, F बहुत कम होता है. But यहाँ पे F एकदम कम हो गया, A एकदम कम हो गया, F A के जितना हो गया. So any adult which is having hemoglobin F too much, reverse हो गया है concentration. So this is very good beta, beta major, very good. So this is your major, thalassemia major. ये क्या है? What exactly is this? In this patient, you are getting another kind of an hemoglobin here, जो normally दिखता ही नहीं है. This is hemoglobin H. So this is hemoglobin H disease. In which kind of thalassemia you see hemoglobin H disease? Alpha, beta. So this is your this patient number 3 beta. इसका diagnosis बताओ. In patient number 3, yes, alpha thal, and how many genes related? 3 genes related in this. ठीक है, this is your HbH disease, 3 gene related. और ये last में क्या है? इन भाई साहब को क्या हो रहा है भाई? What he is suffering from? इन भाई साहब के अंदर this hemoglobin is coming up. What is this particular hemoglobin? This hemoglobin beta, if you see, this hemoglobin is hemoglobin S. So beta hemoglobin S मिल रहा है. Sickle cell. So this is a patient of sickle cell disease. ठीक है? Wow. चलिए 17th question. A 67-year-old male presented with pallor, weakness, fever and bleeding. Lab report shows 58% blast count, which are MPO positive. They are MPO positive. On doing genetic analysis, translocation 15:17. Translocation 15:17 is seen. Comment on the diagnosis. क्या है बेटा ये? Is it ALL, or it is acute promyelocytic leukemia, or it is chronic myeloid leukemia, or is it hairy cell leukemia? Beta, nahi. The correct answer, yes. The correct answer for this question is B, APML. Beta, for CML, you people are giving me the answer as CML. For CML, the translocation is 922. And for chronic myeloid leukemia, for any chronic leukemias, the blast count has to be between 10 to 19%. So when you see the 58% blast, तो बेटा ये acute ही होगा. Then you are seeing MPO positive, तो ये myeloid ही होगा. So it is for sure that this is acute myeloid leukemia. But with the help of this particular translocation, you can also even find out that this is which type of AML, AML M3, which is called as acute promyelocytic leukemia. And thank you very much to all of you for giving the answers for leukemia question right, and you are even answering each, together between yourselves, so that's also good. ये क्या है बेटा? Which kind of blast are these? I'm telling you these are blast. ये कौन सी blast है बेटा? Tell me. Which kind of, both of them are blast. What is this blast? Is it a lymphoblast or a myeloblast? Yes, Aisha, you are right. It is M3. Yeah, Shrijit, it is AML. PML. Trilok, I hope बेटा जो भी आए, hematology आए कि general आए कि systemic आए, आपके question solve होने चाहिए. That is more important. So this, yes, you have given me the answer. This is your lymphoblast. So this is your lymphoblast. Why we are saying it? Because they are not so big as compared to a myeloblast, if you see here, and they do not have cytoplasm. But nucleus है beta. Very scant cytoplasm you have in these cells. So they are lymphoblast. And if they are saying there are blasts and they are giving you blasts like these in which you see a lot of cytoplasm, as you are already giving it, this is your myeloblast. है ना? Myeloblast. What is this? Which type of AML? Which type of AML you are seeing with this? This is gum infiltration. So gum infiltration beta, it is seen with AML type. बताओ फटाफट से type बताओ बेटा. What is the type of AML? Yes, AML M4 M5. AML M4 M5. Okay. And lastly, the most characteristic cell for any kind of AML patient, this is, yeah, yes, M4 M5. Better to choose M5 in that. And the last one in this is gonna be your, you are right, these are your OR rods. Absolutely. These are your OR rods. Moving ahead, a 55-year-old male patient with increased ALP, increased calcium, increased PTH. Bone scans revealed osteolytic lesions. Smearing of the patient shows more than 10% plasma cells. Serum protein electrophoresis shows M spike at the gamma region. What is the most common antibody associated with this disease? पहले तो बेटा this case, because of this M spike and plasma cells being more than 10%, that means plasma cytosis हो रही है. Normally, we do not see these much of plasma cells, but if we are seeing these much of plasma cells, calcium also is more. We can understand this patient is a patient of multiple myeloma. And they're asking you that what kind of antibody you will be having in multiple myeloma. So the type of antibody which you will be having in multiple myeloma, लिखा भी है बेटे तो gamma region में ज़्यादा आ रहा है. So yes, amazing. Multiple myeloma patient and the antibody is IgG. Thank you very much for Now, these cells, they have asked twice in your exam very recently. You all must be knowing this cell, which was a recent exam question. This particular cell, beta, ye kaun si cell hai? What is this cell? Yes, gamma ka matlab IgG hota hai. You are right. So, this cell is your MOT cell. MOT. Very good, Sujit. Very good, Ritvika, Divyani, Prerna. Yeah, you are right. What is this particular cell, beta? Ye kaun si cell hai? This cell, beta, Russell abhi अपन बात करेंगे. This is what? These are your, yeah. These are MOT cells. Flame, very good. Very good. These are flame cells. These particular cells, when we have M protein deposited inside the nucleus of the plasma cells. Yeah, Prerna, they are flame cells. So inside the nucleus, MOT, beta, ye wali cells hain. Inside the nucleus, we are talking about Dutcher. And lastly, when we are having the deposit inside the cytoplasm, these are your Russell. Very good. Very good, guys. All are true about myxoma, except, beta, आपको false statement निकालना है. ठीक है? You need to find out the false statement. The first option is, this is the most common cardiac tumor. Second option, can be seen as pedunculated mass in the left ventricle. Third, associated with TSC1 gene mutation, or none of the above. Nothing is true. Nothing is true. बताइए. देखो बेटा, when we are talking about myxoma, the correct answer, there is no statement in this which is true. So there is nothing true in this. There is nothing true. If they are saying most common cardiac tumor, beta, most common cardiac tumor overall is going to be metastasis. If they say most common primary cardiac tumor in an adult, then it could be myxoma, number one. So this is wrong statement. Can be seen as pedunculated mass in the left ventricle? No, beta. They are seen, myxomas, they are seen in the left atrium. And if left atrium is not given in the option, then you have to go with the fossa ovalis. And associated with TSC1 gene mutation, never. TSC1 gene mutation is for children, rhabdomyo. Myxomas, they are associated with Prakar gene mutation. So this, all the three statements are wrong statements. So answer for this would be nothing right. ठीक है? None of the above. ठीक है बेटा? तो इस तरीके के क्वेश्चन एग्जाम में आ सकते हैं. Easy peasy. ये these kind of questions they can come in the exam. Nothing is true in this. बेटा ये कौन से cells हैं? Which kind of cells they are? ठीक है, what is happening? There was a big cell. All these are blasts actually. What has happened to these blasts? These blasts, when we are making the smear, these blasts got burst. तो ये इनको क्या बोलते हैं? बेटा all of the above ले लो उसको. ठीक है, क्या बोलते हैं इन सेल्स को? अरे हैप्पीनेस जोन, मतलब उसमें कोई करेक्ट नहीं है ना, स्टेटमेंट कोई भी करेक्ट नहीं है. सो नन ऑफ द अबव आंसर हो जाएगा उसमें. यस, स्मज. स्मज सेल्स सीन विद क्रॉनिक लिम्फोइड ल्यूकीमिया. ये कौन सी बॉडीज है बेटा? व्हाट आर दीज बॉडीज? व्हाट इज दिस? एंड दीज, yeah, you are giving me the right answer. These are your Heinz bodies. Heinz bodies. बेटा कितना चीज, मतलब we are talking about You're just seeing things and giving the answers. So, your thought process in which you think that you don't know this, you don't know that, usko mat socho. You know a lot. But just carry on for next 15 odd days and you will get through. Marker for reinfarction. Very good. Heinz ketchup, you are right. So, marker for reinfarction. Yes, CPKMB. The stain, you are right, beta, you are right. Easy peasy. Gaura, Sabha, Naveen, Kevin, you all are right. Stain for myocardial infarction. Whenever infarcted area, what is the stain you are using it? The stain which we are using it is, but if we are asking just a straight question for reinfarction, the answer has to be CPKMB. No, this is your TPTA, triphenyl tetrazolium chloride, TPTC. The stain is TPTC, triphenyl tetrazolium chloride. And which the subtype of LDH increase in the patient of MI? Normally inside our blood, LDH2 is more, inside our heart, LDH1 is more. But if a patient undergoes MI, the myocardium cells, they get damaged, LDH1 comes out. So in the patient's serum after MI, which LDH will be more? LDH1. Alia, you are right, it is LDH1. So amazing. All are true regarding Hinox-Schaulen purpura except. All are true except characterized by IgA deposit. It is a small vessel vasculitis. Thrombocytopenia leading to purpura, that is bleeding. The thrombocytopenia is the cause for that bleeding or none of the above. So what is the answer for this question? What is the answer for this particular question? All are true regarding Hinox-Schaulen purpura except. Is it characterized by IgA? Very good, very good. So you have taken this correct point. In Hinox-Schaulen purpura, there is no thrombocytopenia. There would be no thrombocytopenia in Hinox-Schaulen purpura. So whatever bleed is happening, that is happening not because of this. So the correct answer is C. Beta, ye one is P anka and one is C anka. So I am just writing it P anka and C anka. मुझे सिर्फ ये बताओ, this is 1 and this is 2. So tell me what is P anka? What is 1? 1 P anka है कि C anka है? What is 1? P anka or C anka? जल्दी से बताओ. Yes. 1 is P anka और देखो बेटा, P का मतलब क्या है? पेरी न्यूक्लियर, न्यूक्लियस के चारों तरफ, और C का मतलब है साइटोप्लाज्मिक. तो बेटा देखो, अगर आप ये वाला देखते हो, इन दिस द न्यूक्लियस इज नॉट इल्यूमिनेटेड, द साइटोप्लाज्म इज इल्यूमिनेटेड. सो दिस इज योर C anka. और अगर आप यहाँ पे देखते हो, सो द ऑल अराउंड द न्यूक्लियस यू आर गेटिंग द इम्यूनोफ्लोरेसेंस. सो दिस इज योर P anka. So C anka is 1 and P anka is 2. ठीक. Now, most common vessel involved in Takayasu arthritis. Takayasu arthritis. Takayasu. Yes, you are right. This is your subclavian artery. Subclavian vessel. PAN is positive for which anka? PAN is positive. Yes, CP Mewara, you are right. Yeah. No, beta. Alia, it is not superficial temporal artery. Superficial temporal artery is involved in giant cell arthritis. Takayasu arthritis is subclavian. Yeah. No, Aisha, it is not. It is not temporal, beta. It is giant cell arthritis which is temporal. Subclavian vessel. The arch of aorta is involved. In the arch of aorta, the most common vessel involved is subclavian. PAN. Beta, PAN is not positive for any anka. ठीक है, ये किसी भी anka के लिए positive नहीं होती. PAN doesn't have anka. Okay. Then anti-endothelial antibodies. बच्चे में दिखती है बेटा ये disease. This disease is seen in a child and we have anti-endothelial antibodies. बताओ. Anti-endothelial antibodies in which disease? Where do you see this? Where do you see anti-endothelial antibodies? Beta, ye specifically we are seeing this in a child. Vasculitis की बात हो रही है बेटा. So you see this with Kawasaki disease. If they have given a child of less than 5 years of age, then the answer would be Kawasaki disease for this. है ना, Kawasaki. You can find it other times also, लेकिन less than 5 दिया है तो Kawasaki disease. 21st question, a 29-year-old patient with jaundice is positive for HBsAg, HBeAg and IgM anti-HBc, but negative for anti-HBs and anti-HBe. तो मतलब क्या है बेटा, देखो, it is positive for surface antigen and envelope antigen and the core antibody, but it is negative for the surface antibody or the envelope antibody. And the core antibody is also IgM. What is the probable diagnosis? What is the probable diagnosis? You are absolutely right, Faizan, Dhawal, Augustine, Prajesh, Adrenaline, all of you are right. The correct answer is going to be acute hepatitis B. Why acute? Because you are finding IgM core antibodies. Okay, that is why it is acute hepatitis B. फटाफट से ये कर लेते हैं बेटा. पहले ये बताओ, maximum risk of chronicity is seen with, there are two hepatitis which gives you chronicity. What is this chronicity means? When the hepatitis is converting into a hepatocellular carcinoma or cirrhosis. So maximum risk of chronicity कहाँ मिलता है? Where do you see this maximum risk? No, Rahul, it will be active. It is replicating, very infectious and acute. Non-spreading नहीं है ये. This is not non-spreading, this is spreading. ठीक है. अब मैक्सिमम रिस्क ऑफ क्रॉनिसिटी कौन सी हेपेटाइटिस में दिखता है बेटा? हेमा, यू आर राइट, बट मैक्सिमम इज सीन विद हेपेटाइटिस सी एंड देन इट इज हेपेटाइटिस बी. व्हाट इज द क्रॉनिसिटी रिस्क? 80% इन हेपेटाइटिस सी एंड 20% इन हेपेटाइटिस बी. ठीक है. अब अपन देखते हैं ये वाला टेबल. तो इसमें लाइन से चलते हैं अपन. ये बहुत इंपॉर्टेंट है बेटा. वी हैव 6 of these. 1, 2, 3, 4, 5, 6. So let's start with the first one. पहला क्या है? What is our first? Very good. Already you have started giving me the answers. This is our acute Hep B. Why we are calling it as acute? Because we are having core antibody positivity, we are having envelope positivity and surface antigen positivity. अभी जो question किया है वही same है. Second बताओ. Second one, chronic, yeah. मेवारा, यू आर राइट. बेटा देखो इसमें क्या है, सेम सिचुएशन है, बट देन द कोर एंटीबॉडी हैज बिकम आईजीजी. व्हेनेवर इट बिकम्स आईजीजी, सो यू विल बी कॉलिंग इट एज क्रॉनिक हेप बी. बट क्रॉनिक हेप बी कैन बी एक्टिव, इनएक्टिव, मतलब replicating or non-replicating virus. So if the envelope antigen is positive, it means it's an replicating virus. So chronic Hep B, which is active. So this is chronic Hep B, which is active. Okay. Now this one here, the situation becomes again it's a chronic Hep B, but you are getting envelope antibodies. That means your envelope antigen is getting negative. Envelope antigen is the marker for replication, marker for infectivity. But if you are getting antibodies against it, तो मतलब वायरस मल्टीप्लाई नहीं कर रहा, वायरस मल्टीप्लाई नहीं कर रहा मतलब हेपेटाइटिस एक्टिव नहीं है. So it is inactive. And it is non-infectious or inactive. Very good बेटा. आगे चलते हैं. In this, you are only getting a core antibody, that's it. Patient number 4, only core antibody, nothing else. No antigen, no other antibody, only core antibody. फटाफट बताओ. हेमा, you are absolutely right. Very happy. This is your window period. It is your window period. HBe antigen positive यानी active, बिल्कुल. शांति, यू आर राइट. वेरी गुड बेटा, वेरी गुड. उसके बाद Patient number 5 बताओ बेटा. In patient number 5 you are only having surface antibodies. Only surface antibodies positive, nothing else. सिर्फ surface antibody मिला. Very good Shanti, very good. It's vaccinated. Because in the patient where you are just giving hepatitis B vaccine, you are just giving the surface antigen inside, so body will only and only be making the surface antibody, so it's a vaccinated patient. And finally the last one, yeah, Afzal, you are right, it is a recovered patient. Recovered. Sixth is recovered. Okay, because you are getting the core antibody also and you are having surface antibody. Core antibody will be present in any person who got infected. So जिसमें infection हुआ है उसमें core मिलेगी ही मिलेगी, and surface antibody is the marker that the person has recovered. Okay, very good. Yeah, cured. चलो, marker for HCC. What is the marker for HCC बेटा? Alpha fetoprotein marker is the marker for HCC. Alpha fetoprotein. This question was a very famous question in your exam. That what is the marker for HCC? Now, gene for Wilson's disease. What is the gene for Wilson's disease? Come on, let's tell me. What is the gene for Wilson's disease? The gene for Wilson's disease is, yes, you are right. You are right, guys. The genes for Wilson's disease is, yes, it is AFP. You are right. बेटा AFP नहीं है ये, you are right, Ritika. It is ATP7B gene. Okay, and gene for hemochromatosis. The gene for hemochromatosis. चलो बेटा फटाक से बताओ. Gene for hemochromatosis. Gene for hemochromatosis. Iron overload का problem हो जाता है इसमें patient में. Hemochromatosis के अंदर. Your exam question this time they asked you about the gene, and yes, you are right. Thank you very much. It is your HFE gene. HFE. Yes, Naveen, Alia, Ritvika. Thank you very much, beta. This is your HFE gene. ये बेटा 13 पे रहता है, 13Q पे, and this is on 6P again, HFE gene. So, collagen which is seen with cirrhosis. In cirrhosis, what happens? Normally, the sinusoids, they contain which type of collagen? Collagen 4. But what will be the type of collagen eventually you will be seeing in cirrhosis? What is the hallmark of cirrhosis? The hallmark of cirrhosis is capillarization of sinusoids. है ना बेटा? It is your capillarization of sinusoid. So, the sinusoids, they become capillaries. So, what is the type of collagen you will get? Yes. Yes, Gaura, Dilip, Shanti, all of you. Suma, yes. So, 1 and 3. Okay? The collagen seen with the cirrhosis is going to be 1 and 3 collagens. Very good, Sujit. Very good, beta. Now, in this image, there are two things which we are seeing. Two things. One is with this arrow. I am telling you, now this becomes a pink and blue image. मैं ये बोल रहा हूँ, this, I am giving you a history that this image, this biopsy has been taken from a liver. So whatever you are seeing, these are your hepatocytes. Now inside the hepatocytes, and this patient is an alcoholic patient. So inside this patient, in the hepatocyte, I am getting this pink color deposit. So what is one of the most characteristic finding of alcoholic hepatitis on biopsy? ठीक है बेटा देखो, this with this star what you are getting, this is your Councilman body. This is your Councilman body when the hepatocyte has become small and eosinophilic. Apoptosis हो गई है ये. So this is your Councilman body. Alia, बेटा देखो, ये this here is the Councilman body, but this particular thing, when you see inside the hepatocyte, ये जो है ना बेटा, या राहुल, I'm so proud of you, beta. These are your Mallory-Denk bodies. So we have two things, Councilman and Mallory-Denk. Councilman is like hepatocyte itself is becoming very small and pinkish. And when we talk about Mallory-Denk bodies, which are seen in alcoholic hepatitis, they are seen in many diseases, but they are seen in alcoholic hepatitis. They are like eosinophilic inclusion inside the hepatocyte. ठीक है बेटा? So Wow. Yeah. Yeah, Shanti, Prerna. Very good, Mother One. There are two bodies which are seeing here. Star indicates Councilman and arrow indicates Mallory Denk. चलो, ये hereditary hyperbilirubinemia में, this you must be knowing that our RBC they gets broken with 120 days. Then there's a hemoglobin which comes out. We have heme and globin. Heme then associates with protoporphyrin, becomes unconjugated bilirubin, combines with albumin, gets into the hepatocyte. Inside the hepatocyte, there is an enzyme which is UGT. This unconjugated bilirubin converts into conjugated bilirubin, and then it is given to the gallbladder for storage. Now the point is that there are 4 diseases for hereditary hyperbilirubinemia. मेरा पहला क्वेश्चन आपसे है, what is the disease which will be happening due to decrease in the UGT enzyme? What is the disease which is happening due to decrease in the UGT enzyme? बताओ. ठीक है, UGT enzyme decrease होने की वजह से क्या disease आएगा बेटा? Very, very good, Faisal. Faisal, I'm so proud you're giving me all the answers. Wow, wow, wow. So this thing is your first hereditary hyperbilirubinemia thing. This is your Gilbert syndrome. So I'm writing just GS. And if somebody is having absence of UGT, as you people have already answered me, okay, then it is Crigler-Najjar syndrome. Crigler-Najjar. So when UGT is not present, it is Crigler-Najjar. अब बेटा अगर वो आपसे पूछते हैं what is the most common hereditary hyperbilirubinemia, so this is your Gilbert syndrome. And if they're asking you worst prognosis hereditary hyperbilirubinemia, then it is your Crigler-Najjar. ठीक है? अब it becomes very easy to understand that in both of these diseases, what will be more? Conjugated, unconjugated. It will be unconjugated bilirubin which will be more, because you are having problem with the UGT. It will unconjugated will not convert into conjugated. Up conjugated bilirubin given to the gallbladder for storage with the help of these two molecules, OATP and MRP2 protein. Now, what will be due to OATP? First, you tell me OATP. फटाफट. OATP बताओ बेटा. Yes, Faisal, unconjugated. Rahul, unconjugated. You are right, Aline. Very good. Now, point being that what will be with this OATP? If this is not present, what kind of disease would it will cause? Very good, beta. Dubin-Johnson, and MRP2 is not there, then it is Rotter syndrome. So, these both will have high conjugated bilirubin, and these both will have high unconjugated bilirubin, this being the most common, this being the most severe. A 78-year-old male has increasing dyspnea over the past 4 months. A CT scan shows a dense, bright, right pleural mass encasing most of the left lung, and a pleural biopsy shows spindle and cuboidal cells that invade adipose tissue. Inhalation of which of the following material is probably an important factor in developing of this mass? Beta dekho, you are seeing invasion in the lungs. That means they are talking about lung cancer, and they are asking you that what is the material because of which the lung cancer could happen. Your choices are asbestosis, silica, cotton fiber, coal dust. So answer. Wow, very good. So beta आपको पता है the pneumoconiosis which is causing the most common the pneumoconiosis which is causing what? Lung cancer most commonly is asbestosis. So your answer is A. Asbestos. Okay. Then most specific cancer associated. Memon definitely will be sharing the PDF. Don't worry. The most specific cancer associated with asbestosis. Most specific cancer. Yes, you are right. Beta dekho, most common cancer, that is your lung cancer, bronchoalveolar. But if they are asking about most specific cancer with asbestosis, yes, you are giving me the right answer, mesothelioma. Then most common interleukin associated with ARDS. ARDS के लिए बेटा specific की अगर हम बात करते हैं, then you have to go with mesothelioma, okay? Most common interleukin, if we are talking, then it is, yes, you are right, it is going to be interleukin 8. Most common lung cancers in females. Most common, yeah, Shrijit, absolutely right, Shrijit. Prerna, you are also right. Afzal, you are right. Dilip, right. Alia, you are also right, beta. Naveen, amazing, beta, amazing, amazing. All these. What is the most common lung cancer in a female? The most common lung cancer in a female is Hema, you are right, beta. Alia, you are also right. Shrijit, all of you. Thank you very much, beta. Adenocarcinoma, you people have studied very well. Increase read index. Beta, read index किसके साथ होता है? Which disease has got increased read index? And what do you see in read index? You are seeing the mucosal gland layer thickness. So what is the disease, the obstructive kind of a disease in which we have a lot of mucus production? We are having a lot of mucus production in which disease? Yes, you are right. It is your chronic bronchitis. Chronic bronchitis. Thank you very much, guys. Thank you. And synaptophysin and chromogranin, I've just told you that synaptophysin and chromogranin, they are the markers for neuroendocrine cells. And which lung cancer is arising from the neuroendocrine cell? Your small cell cancer lung. Small cell cancer lung. Yeah, beta. Yeah. Yeah. Very good. Very good. Now, these, what is A? What is B? What is C? And what is D? Let's talk about A first. This is your A. ये क्या है बेटा? These are your actually 3 C's which you are seeing in the sputum. If I'm saying this is a sputum finding and you are getting these kind of crystals, this is your Charcot laden crystal in the sputum seen in the patient of bronchial asthma. ये क्या है बेटा? This is your B. B. Yeah. Yes. This is your B, beta. Ye, yes, absolutely right. This is going to be your spirals. What are these spirals? These spirals are your Kirschmann spiral, again seen with bronchial asthma. This is the C image. What is this particular image? Very good, beta, very good. These your, somebody has given the answer already. This is your Crayola bodies, in which you are seeing sputum mixed with dead respiratory cell, and this is your recent exam question. These are your ferruginous or asbestos body which are seen in the pneumoconiotic disease called as asbestosis. Okay. Then types of emphysema. What is this particular type of emphysema? What is emphysema? Where you are having dilatation of the smaller airways. So beta देखो, ये क्या है? This is your alveoli. This is your, respiratory bronchiole, alveolar duct and the respiratory bronchiole. So you are having the dilatation of the proximal asinus. So when you have proximal asinus dilatation, what it will be called as? Proximal asinus का मतलब हो गया बेटा centry asiner. Very good Swarna, very good Ritvika, very good Fazan. This is your centry asiner. Second बताओ बेटा, ये वाला बताओ. You are having dilatation at the, where do you have this dilatation? ये क्या है? Alveoli. So alveoli are getting dilated. So this becomes your distal. क्योंकि alveoli are most distal, no? So this becomes your distal. ये क्या है? In this, the whole asinus is dilated. So whole asinus is dilated. So it will be called as, yeah, Kapil, it could be distal or paraseptal. It is same. Yeah, paraseptal or distal, it is same beta. ये एकदम same है, कोई दिक्कत नहीं है. Yeah, Ritvika, it is your pan asiner. And ये वाला last जो है ना बेटा, this is irregular, which is not seen just like that. It is on the microscope we see that. Most common कौन सा इनमें से? What is the most common out of all these? The most common emphysema out of all these 4. फटाफट से बता दो बेटा. Most common emphysema बताओ. What is the most common emphysema out of these 4 emphysemas? बेटा most common emphysema पूछ रहा हूं मैं. Yes Kapil, yes Swarna, Shanti, Suma, Shrijit. Ritvika, yes, this is the most common. और इसका जो रीजन है बेटा वो स्मोकिंग इज द मोस्ट कॉमन कॉज, whereas for pan-acynar this is the second most common and it is due to alpha-1 antitrypsin deficiency. A 16-year-old child came to hospital with complaints of presence of lots of foam in the urine. That means proteinuria is happening. Urine examination shows massive proteinuria and lipiduria. Renal biopsy reveals duplication of the basement membrane. What is the best diagnosis? The options on your screens are diffuse proliferative glomerulonephritis, membranoproliferative glomerulonephritis, membranous glomerulopathy, and minimal change disease. So, beta, what are you seeing? बच्चे, there is duplication of the basement membrane. Biopsy पे क्या मिल रहा है? Duplication of the basement membrane. Duplication means tram track appearance. Yes, this is बेटा tram track appearance मिल रही है ना, तो duplication of basement membrane is seen with membranoproliferative glomerulonephritis. Minimal change disease, you will not see anything on the renal biopsy. In a minimal change disease, you will just find the effacement of foot process of the podocytes, and that too on electron microscopy, not on normal microscopy. तो बेटा ये आंसर क्या है? The answer is B in these patients. B. B बेटा, duplication of basement membrane लिखा है ना यहाँ पे. This is the biggest hint in this question. Straight away finding tram track appearance, splitting of the basement membrane, and nephrotic syndrome. So MPGN is the answer. B. चलिए, subepithelial hump and starry sky appearance in kidney. We are talking about kidney. So subepithelial hump and starry sky appearance. बेटा फटाफट बताओ. Now you people are giving the right answer. It is MPGN. Yeah. Subepithelial. बताइए फटाफट. Subepithelial humps and starry sky pattern. It is seen with. Yes, you are right. Thank you very much, Alia. It is PSGN, post-streptococcal glomerulonephritis. ठीक है. Group A beta hemolytic streptococci is the etiological agent. Molecular mimicry हो जाती है. Most common cause of recurrent hematuria. Come on, guys. Start giving the answers. Most common cause of recurrent hematuria. जब भी ये word आता है, very recent question of your exam. Most common cause of recurrent hematuria. Yes, thank you very much. It is your IgA nephropathy. IgA nephropathy. In Goodpasture syndrome, which chain of collagen is defective? Yes, Ishan, Prerna, Divyani, thank you. In Goodpasture syndrome, बेटा कौन सा change आता है? बेटा not minimal change disease. बेटा recurrent hematuria के लिए minimal change disease नहीं हो सकता. Minimal change disease is nephrotic syndrome more commonly. So, hematuria is not a prominent feature of minimal change disease. Okay? So, in Goodpasture syndrome, yeah. Beta, which chain of collagen? I am not asking which type of collagen. Type of collagen is type 4. But which chain of collagen is deficient? And you are giving the right answers for that. That type 4 collagen is gone, but the chain is alpha 3 chains. Spike dome appearance, spike dome. Spike dome appearance in which kind of glomerulonephritis? Spike dome is seen with, ठीक है, membranous glomerulonephritis, spike dome appearance, okay? And nephrin gene mutation leads to which kind? Yeah, alpha 3 chains, absolutely, alpha 3 chains. And which gene is mutated? Nephrin gene mutation leads to which kind of disease, beta? Yes, it is NPHS1. Finish type of congenital nephrotic syndrome. Good prognosis. Podocin causes congenital nephrotic syndrome type 2, poor prognosis. Second last question for the session. A 68-year-old diabetic male presented with blurring of vision. Urine examination showed proteinuria. Fundus examination showed dot and blot hemorrhages, microaneurysm and cotton wool spots. Most characteristic findings seen on biopsy. बेटा ये पूछ रहे हैं मोस्ट कैरेक्टरिस्टिक फाइंडिंग। ये पेशेंट को क्या हो रहा है? दिस पेशेंट इज हैविंग डायबिटीज, सो इट्स अ पेशेंट ऑफ डायबिटिक नेफ्रोपैथी। सो दे आर आस्किंग यू द मोस्ट कैरेक्टरिस्टिक फाइंडिंग, टेल मी द आंसर 24 का आंसर फॉर 24th number question. Is it diffuse glomerulosclerosis or basement membrane thickening or focal glomerulosclerosis or nodular? Beta C, you are making a mistake in just reading the question properly. Now they are asking you the most characteristic finding, not the most common finding. Okay, diffuse glomerulosclerosis happens to be most common finding, beta, most common for a diabetic nephropathy. Basement membrane thickening, beta, this happens to be the earliest finding, earliest. But if they are asking you the most characteristic finding, then it is going to be nodular glomerulosclerosis, which is also called as Kimmelstein-Wilson lesion. Kimmelstein-Wilson lesion. Now these are characteristics, beta. These are characteristic. So the most characteristic finding for a diabetic nephropathy on microscopy will be your Kimmelstein-Wilson lesion. अगर glomerulus की हम बात करते हैं तो, and which these Kimmelstein-Wilson lesion, they are also called as nodular glomerulosclerosis. ठीक है? So the answer would be D in these patients. Now, what exactly are you seeing this? What is this? This is this cylindrical structure which is containing a urine examination है बेटा. यूरिन में क्या मिल रहा है ये? What is this? What is this particular thing? Shrijit, initially things could be focal, but eventually they will become diffuse only because diabetes is going to damage the whole kidney, whole glomerulus. So initially it might be focal, but eventually it will become diffuse. Beta, if we compare these two, now please tell me, this one you are telling it to be in a RB. देखो ये normal तो है ही नहीं. This is not normal because normal cast, these are casts seen in the urine, cylindrical structure, but these are not normal. Why they are not normal? Because बेटा इनके अंदर cells हैं. What cells are these? Are these WBCs or RBCs? और ये क्या है? Are these WBCs and RBCs? So बेटा these are WBCs. So this is your WBC cast. क्या है बेटा ये? Your WBC cast. You would see this WBC cast in pyelonephritis. And here you are having these RBC cast. Yes. Faizan, बेटा ये हाईलाइन नहीं है. हाईलाइन में you will not get nothing. You will get nothing in hyaline cast. I'll show you hyaline cast. I'll try if I can find out the hyaline cast. Hyaline casts are very, they are very, very, very simple. See this. This is your hyaline cast, beta. इसमें कुछ भी नहीं है. There's nothing inside, right? So this is your hyaline cast, but the cast which I have shown, that is not the hyaline cast. That is what? This one is the WBC cast, which is seen in pyelonephritis. And this is your RBC cast, which will be seen in nephritic syndrome probably. But if nephritic syndrome is not given, then even in glomerulonephritis, you will see this. This image here, again a glomerulus in which you have these nodular deposits. So beta, this is the most characteristic finding of diabetic nephropathy. This is your Kimmelstein-Wilson lesion. Nodular glomerulosclerosis. So they will not give you the direct image, but they will give you this image as a reference, and they will mention that the person is suffering from diabetic nephropathy और उसको nodular deposit मिल रहा है. What exactly is this? This is your Kimmelstein-Wilson lesion. Okay, and ये क्या है बेटा? This is very prominent image, very very good image, which I feel that everyone can tell. This one, this image, तो ये आपको बताना पड़ेगा. You will have to tell me this image, that what exactly is this image, which kind of glomerulonephritis we will see. Which kind of, yeah. So, what are you seeing this? बेटा ये amyloid नहीं है बेटा, ये amyloid नहीं है. This is a crescent. Absolutely right. The first person to answer is Srijit. Beta, definitely you will get the telegrams everywhere. Don't worry. Okay. This is very good. Very good. Beta, this is a crescent, which is a half moon shaped structure which is giving you immunofluorescence. This is your crescent. This is seen with rapidly progressing glomerulonephritis, RPGN. The last question for the day. Comment on the area marked with an arrow between hypercellular area and hypocellular area seen on the brain biopsy under light microscope. So ये वाला area कौन सा है बेटा? Between a hyper and hypocellular area. कौन से tumor में मिलता है ये? This is seen in schwannoma, which is also called as acoustic neuroma. Gene mutation for this particular disease, NF2 gene. We have discussed this multiple times. You all must be knowing. So बेटा ये क्या है? ये this area which is acellular. What is this area called as? Very good. The correct answer for this question is Verroque bodies. Verroque bodies, they are the area between the hypercellular and the hypocellular area. The hypercellular area is called as antennae A and hypo is called as antennae B. Last slide. Samoma bodies. Beta, samoma bodies with which brain tumor, if we talk about brain tumor? Quickly give me the answer for this. The last slide for the day. Samoma bodies are seen with which brain tumor? Samoma bodies. You are right, Simran. Tanishk. Yeah, Ritika, it is like full. The mnemonic which we have learned is PSM, and M stands for meningioma. So if we talk about the brain tumor in which samoma bodies are seen, it is meningioma. Flexner intestinal rosettes. Yes, guys, yes. Very good. Flexner intestinal rosettes, beta. ये किसके साथ दिखेगा? Flexner intestinal rosette. These are seen with. Wow. Thank you very much. It is seen with retinoblastoma. Ritz, Alia, Ritvik, Faizan, Shanti. Thank you very much. Retinoblastoma. And Homer right, as you have already answered, that this is medulloblastoma. अब ये बता दो बेटा, ये दो क्वेश्चंस और बचते हैं. मोस्ट कॉमन प्राइमरी ब्रेन ट्यूमर इन अ चाइल्ड. प्राइमरी की हम बात कर रहे हैं. Most common primary brain tumor in a child. I have not mentioned benign malignant. It is just primary brain tumor. So if they're asking about a primary brain tumor, no. Beta, medulloblastoma will be a malignant tumor in a child. Primary brain tumor, pilocytic astrocytoma. Okay. And if they are talking about most common primary tumor, brain tumor in an adult, primary का मतलब originating from the brain बेटा, तो metastasis answer नहीं हो सकता. Very good. Metastasis cannot be the answer because we are using the word primary. Whenever we are using the word primary, that means the tumor is originating from that particular organ. तो वो गलत है बेटा. Metastasis will not be the answer. And adult के अंदर most common primary brain tumor की अगर हम बात करते हैं तो meningioma. Okay. Chale. Thank you very much for listening to me. Now we are moving into the last phase of our preparation. This is what I want to tell you. ठीक है? I want to thank you first of all for being with me for so long. ठीक है? And बेटा नहीं, glioblastoma नहीं होगा इसका आंसर. Why not glioblastoma? Because we have not talked about the malignant tumor. If it's a malignant tumor, then glioblastoma. But benign malignant use नहीं किया है, तो we'll just go with meningioma. ठीक है बेटा? चलो. So, thank you very much first of all from everyone here to stay with me for so long. And the best part is that you were answering, like this. And I don't know how you feel about yourself, but then we sitting here, when we see these kind of answers, we become very happy. So thank you very, very, very much for, answering to all the questions. Now, this is the time when your mindset is going to play a very, very, very important role, guys. So whatever you are talking now to yourself, that has to be healthy and very positive. This is not the time when you would think that this is going to happen, that is going to happen. Only one thing you have to think, and that is that you're going to make it true. You're going to make it true. So you talk positive now. Don't think ये रह गया वो रह गया. बेटा सब किया है आपने, हो जाएगा. Just hang on for 15 more days. Okay? And 4th of June is going to be the time when you are going to get back everything what has not been given to you. So read this. To all the doors that was closed on me, I am coming back to buy the building. Darwaza chodo, sab khareed lenge. So the point is, beta, whatever you have gone through, you have worked very hard from last 3-4 months. You just keep continuing this for next 15 more days. And I'm telling you, to all those people who have doubted you, to all those things who have seen you with, degraded remarks, or who have said that you can't do it, you're going to make everyone around you, people who love, proud. Okay? So from the entire MIST team, I want to wish you good luck, and we hope and we believe that you're going to focus on what you exactly should be doing right now. Do not go here and there. Stay where you are. Read what you have read in last 3-4 months, and everything is going to be all right. Thank you.